lot. So have you been able to reach out to anybody? Someone that's maybe you have not seen for quite a long time? Have you been able to reach out to check on the person and just to be sure the person is doing right? What have we actually done from the training that we had last week? So the floor is open,
Okay.
please.
Good
Yes.
evening, my colleague.
Okay, Helen. Helen,
Yes,
please
ma.
go ahead. Yes.
Yes, ma. My own side, I didn't really get, I didn't really get in touch with anybody, but
Okay.
I want to say that the last class we had was really impactful, and I learned a lot. Then I already started applying it in my day-to-day life activities.
Okay.
You understand?
That's good.
Yes. Because I understand that mental well-being is it's like a way of
Very
life.
important. Yes, that's true.
So yes, so already there are some things I was really doing wrong. I was not really doing right as a person, but because
Mhm.
of that, yes, yes. Like I'm this person that I don't drink. I hardly drink water.
Mm. Helen.
Hello,
Yeah.
Mildred
I
is
hardly.
here.
Okay.
Okay, Mildred, you're welcome, Mildred. It's nice to have you.
Yes,
Yeah.
can I
I
talk? Okay,
No,
she's not
Helen.
okay.
Helen was still on the line, please.
Okay,
Helen.
Helen, sorry.
So as I was saying, I'm this person. I'm sorry. I'm not even. I'm cooking right now, trying to cook evening meal, so not settled. But let me just try and contribute. So I'm this person that I hardly drink. I don't drink water that much, But from the lectures, I learned a lot. Like now, I apply it to my day-to-day life activities. You understand? As a mother, as a
That,
woman, and also as a wife. You understand? There are
that's
some things now. There are some things now I observe a lot now. You understand? So it has helped me a whole lot. I will not really have time to say what I've just in this
yeah.
1 week interval. I've already applied it, and it's really working for me. And there are some
That's
things,
nice.
you understand. So our life will not that time will not permit me to say all of that. But
Mm-hmm.
all in all,
Mm-hmm.
I've really learned a lot, and I'm
Beautiful.
already
Thank you
applying it.
so much.
Thank you. I
Thank you,
appreciate
Helen.
you.
Thank you so much. Even though you said you are cooking, so please make sure you don't take your device into the kitchen because today we are talking about emergency response. So please
Yeah, even the cooking.
endeavor to take your device away from a fire, maybe cooking gas
That.
or whatever.
Oh,
It's not very
okay.
good. So please
Let
do
me
that.
let me
And
teach in
then
it.
as we are cooking, one ear should be in the kitchen, the other ear should be with us
Exactly.
because it's
Exactly.
important.
I
Thank you,
understand.
Helen.
Exactly.
Thank you so much. I'm so glad to hear that at least that we are actually doing something. Thank you. So, Mildred, please, the floor is open for you. It's nice to hear your voice because I missed your voice for some time now. Go ahead, Mildred, please. Hello. Okay. As if it just stopped. Can everybody hear me? Am
Okay,
I
can you
on?
hear me?
Yes,
Can you hear
Mildred.
me?
Very well. Very well. Go ahead.
Okay, I was able to reach out to a colleague because
Wow.
her lifestyle has been so funny, and a lot of people, other fellow colleagues have been criticizing her. Charlie comes to work, excuse here and there.
Mhm.
So after the lecture, I called her. I told her I wanted to see her.
Good.
Hello, sorry,
Yes, I'm
we
with
couldn't.
you. I'm with you. Yeah.
I spoke to her on phone, and she came to the office today, and I tried to find out why she wasn't, what was happening in her life, and I saw that her own case is even gone to serious depression because of
Oh,
debt. You know,
oh, 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 oh.
yes, she has not been able to manage her finances well, her salary,
Mm,
and that is what has been affecting her.
you
So
see.
yes, seriously, that
Ah.
if people have been criticized after that lecture. I said there must be something wrong with her.
Ah,
That let
yeah.
me reach out to her. So I'm also seeing her tomorrow because she told me how much she's owing, and the loan is eating her heart, even to pay school fees now for her children. And she borrowed because of those children, and at the end of the day, she can't continue paying the school fees. And I told her that, look, you cannot borrow to pay school fees because
that's right.
Instead you change the school, they must attend that school.
Yeah.
So what I'm trying to, I told her that I will reach out to the bank and see how they can republish the loan.
Jesus.
I know, not just for school fees. She bought a car. Her car had issues. She bought another car, but the car didn't even take any money. It's the school and other things that took money because the car is just
another.
Yes, you put them in a private school where 1.5 million for one person and it's nothing. So we're handling it. It will be okay. I've already told her that she had to change their school to a federal or state university. Very low. Under 500,000, she can pay the two schools. She said she wasn't aware. So we are on it, but thank you so much. So there are some other colleagues that I know that after that lecture, when I saw the kind of how they behave and all that, I still have to talk to them.
You are just too much. You are too much, Mildred. You are too much.
Thank you so much.
I love that. Thank you so much. I love to hear that. You see, people have real problems. People have real problems. Do not allow, like I said, my mother used to say, is the roof that covers us, our nakedness also covers us. So people have real problems. So when you see people dress up like women, women, we are very good at what we do. We are good at packaging, even when you are not you are not in your best frame, or you just want to put up that, so most times people don't even get to know what a whole lot of people actually go through, but I'm so happy to hear that. I'm glad, because this month is actually mental health month, awareness month. October, every October is always celebrated. A day is set aside. So it's important. What you did is very very important. You don't know the weight of what you have done, Mildred. You may not know. You may just think, okay, at least I lent a hand, but you have helped to salvage a situation that could have been worse. Maybe, who knows, if that depression had degenerated, of course, we know what would and could be the end result. So thank you for that step. And I trust that you do more of that work. You keep doing more of that work. Thank you so much. So do we have any other person that has anything to say before we quickly move? Today, okay, if there's still someone left, let me give at least one person an opportunity to tell us. Last week was really enriching, because mental health awareness training is one that helps us cut across not only where you work, or maybe being a frontliner in the health work. In your personal lives, just as Helen has said, in your personal lives too, you learn to take it easy on yourself. You learn not to get worried. I used to tell people, what you cannot change, don't overflog yourself for it. Don't keep flogging yourself. Oh, this thing, no. Because your mental health is important. The rate at which people keep moving crossing over to the other side, you hear of a person, before you know what happened, they say the person slumped and so on and so forth. And how I wish the people over there can actually talk. We would understand the importance of ensuring that whatever you do, ensure that your mental health is intact. Take it as important as you take your physical health. When you have a headache or when you have a fever, it should even be more important in this case. So thank you so much. Please, is there any other contribution from anybody? So only Mildred and Helen actually took home something. Okay. Osareme. Hello, Osareme. Osareme. Okay. All right. So let's go ahead. Today, without wasting time, we want to look at basic first aid training. Like I told you that this training, any health-related training, is more of a practical thing. But it will not be very nice and smooth for me to go ahead with the practicals like that without giving you maybe an overview of what you are going to see, or without looking at the theoretical aspect of it. It will not it won't be very, very advisable to do like that. So hence, I decided to excuse me, I decided to ensure that we have the theoretical aspect of it. So get ready, just keep yourself, stay relaxed. We are just going to delve into what we are going to see. Tomorrow, God willing, our practical starts tomorrow. If we have, maybe we could take 1 hour to run through the 3 modules remaining. Those 3 modules are practically ethics and legal and ethical issues, mobility, and I think just 3 modules left for us. So it's not going to be too, just within 1 hour, we'll get through that. It's not something bulky. They're just straightforward things, So we'll have our practicals tomorrow, Thursday. We'll have our practicals next week, Wednesday, and then we'll have next week, Thursday. For tomorrow's practical is purely the first aid practicals, like the CPR, the first aid, what you need to know as a mental health practitioner, one in the health setting, the things that you practically need to know. Now, excuse me. Today we are going to look at the basic first aid. We are going to look at emergency response, and we'll look at professional development as well. Those 3 things we are going to be looking at now. Okay, so basic first aid. Now, we want to first and foremost look at emergency response. Now, like I like to start my trainings telling you stories, giving you illustrations. Now, it was, like I said, before I did 1 or 2 services. Thank you, sweetheart. I did 1 or 2 services, working in the hospital and here and there earlier. And something happened one of those days. It was a typical Tuesday afternoon in the hospital, and I was on my shifts. That's so many years ago, when I was still perhaps in the foundational stage in the health sector. I was in it. It was a typical Tuesday, I'll never forget, in the hospital, and I was on my shifts, trying to do what I know how to do best. Now, the ward where I worked was bustling with activities because it was a big hospital. I felt a sense of calm knowing that I had my routine down. Like I knew, okay, this is what I'm going to do. I already know I'm going to attend to a couple of patients. I'm going to do 1 or 2 things. I had already mapped out my routine. Suddenly, the serene environment atmosphere shattered. Something just happened when a loud crash echoed from the patient's room down the hall. I was in the first hall A, and then the first patient's room. I was there when I heard a very loud code, a sound. I rushed towards the sound because it was quite close to where I was. I rushed towards the sound. My heart was actually racing. As I entered the room, I found a patient, one of the patients. I'm trying to recall the patient's name. I think I can't, Martha or so. I'm not very sure because it's a long time. So this lady, an elderly lady, a woman, from her bed. Like I don't know how she turned or how she repositioned herself. She fell from her bed. Her face was pale and she was clutching her chest. She was holding her chest and struggling to breathe. Like I didn't know what to do. The sight of her, vulnerable and in distress, struck me deeply. I didn't know what to do. In fact, at that point, I stood. I was torn between, what do I do? Do I move forward? Do I move backward? Other people were trying to reach me at that particular point when that thing happened. In that moment, my the little training I had as at that time kicked in, but the emotional weight of the situation was overwhelming. It overwhelmed me. The woman was on the floor, clutching her chest. She had totally gone pale. I didn't know what to do. They were rushing. People were coming to my aid like, oh, what do we do? And there was so much pandemonium. I had to balance my instinct to comfort Martha. Let's take her name to be Martha because I can't remember her real name. And my mind raced with questions. Was she having a heart attack? Did she injure herself in the fall? That is so many things. Oh, she's clutching her chest. Is it a heart attack? Did she injure herself in the fall? I quickly assessed the situation. I called for help using the emergency button, like, in the hospital. So I had to press the emergency button immediately. And I was trying at the same time to reassure Martha that help was on the way. I had to reassure her, don't worry, calm down. Are you all right? Hold on, help is coming. You have to keep reassuring, or I had to keep reassuring her. But at the same time, I waited. When I was waiting for the other people for help to actually come, for the medical doctor on shift as at that time to reach us, I had to remain calm, even though I felt a surge of panic. I was scared. That's the truth of the matter. I like being very realistic. I was scared. There was a surge of panic. And I remembered my training. I remembered that I needed to keep the patients calm, because I cannot be in a panic situation and then be shaking and confused. How then will I be able to reassure the patient that is actually having that issue? So I had to pull myself together to be able to calm down the patient, monitor the patient's vital signs, and provide support. Very important. So when the doctor arrived, we worked together seamlessly, and she instructed me to help Martha into a more comfortable position. And together we checked her pulse and her breathing. Quickly, we went through that. We checked her pulse, we checked her breathing. Thankfully, to God be the glory, she was actually stable. But the incident highlighted how quickly a situation can escalate. I like to start every training with telling you a story. Imagine the space of time between when she fell off that bed. If nothing was done, who knows what would have happened to her? So what did I learn from that particular experience that I want to share with you before I delve into what we have for today? You understand? Now, first thing I learned from that particular situation is staying calm. Ensure that you stay calm under pressure. That is one particular trait that a caregiver needs, that a CHCA needs, that a CNA needs, that anybody in the healthcare system, that's one particular quality that you need. The quality of being stable in the midst of issues, in the midst of problems, in the midst of an emergency, because most times things have happened. Oh, Susan Olaruwaju, it's nice to have you. Susan, I tried reaching you today, and I called. Your line wasn't going through. Please kindly ensure to call me after this training if you can hear me, Susan. Thank you. So, yes, so I learned that maintaining composure not only helps you think clearly, but it helps you reassure the patient that they're in safe hands. We've seen situations where things happen. You see, God forbid it, maybe there's an accident on the road. Help would have come to that person. That person would have been maybe attended to, but because of confusion, because of pandemonium, because a whole lot of people are there at the same time, busy doing nothing. So in that single process, in that split second, there's a very thin line, like I tell people, between life and death. There's a very thin line, just like a tiny thread. So when a person is actually having an emergency, it is important that we know how to act immediately, especially when there are issues like cardiac arrest, like heart attack, like very, very severe issues like that wouldn't give you the wealth of time, wouldn't give you time for you to gamble or to think of, should I do this, shouldn't I do this? No, because in that space of time, anything can happen. So I learned to stay calm, which I am sharing now before we delve into it, because we'll just have to go through most of these things. Tomorrow is the real practical way you see it play out. So maintaining composure is very, very important under pressure. Again, teamwork is essential. That's another thing I learned from it, because the swift response from my colleagues reinforced the importance of teamwork in emergencies. We communicated effectively, which allowed us to provide Martha the best care possible. It allowed us to do that in that space of time, because reach out to this, call this, call the doctor, get the first aid box, do this. Before you know, in a split second, that situation was arrested. So teamwork is very essential. Wherever you work, ensure that you maintain that spirit of teamwork, because teamwork actually makes dream work. So if you have a collective dream, it can only be achieved if you work as a team at the end of the day. So another thing is empathy. Empathy matters. I learned that. That's number 3. While technical skills are crucial, yeah, we know technical skills are very important. Your real life skills are very important. The emotional support that you provide as a healthcare practitioner, I cannot overemphasize that. From day one of this training, if you observe, there is no topic we talk that we don't touch the emotional aspect of it, empathy, showing handling a patient's emotional side, because people are different. There are people that are highly emotional. Just for you to tell them, let them know that, yes, there's help out there. There's a shoulder you can lean on alone. That alone gives them a green light. They hold on to that, knowing that, yes, it's not futile. There's a way out in every situation. Very important. And also, like the way I tried to, because she was actually afraid, Martha, when that incident happened. So I tried to reassure her, everything is going to be all right. You are fine. Trust, you are good. You are going to be, because automatically there was fear written all over her. So the softness in your voice, you speaking and reassuring that person, can go a long way in helping that person remain balanced until the actual help comes, especially in a situation outside the hospital. Now, also preparation is key. Regular training and drills can make a world of difference. When you keep updated with the current trends in the field of medicine, you keep yourself abreast, you keep doing training. Some people don't really understand the importance of trainings. They just feel that, yes, we are just spending money. Those that don't know. They say, who doesn't know, doesn't know. But if you actually know what you are gaining from it, forget. I tell people that knowledge may be expensive. Oh, you have to pay for this, you have to pay for that, you have to pay for this, for the other one, and so on and so forth. At the end of the day, you find out that knowledge cannot be quantified, because when you try ignorance, you see that ignorance is more expensive. That's the truth of the matter. So, preparation is key. When you have the right knowledge, you have the right training, you would be equipped, you'll be prepared to handle any emergency. Which is very, very important. So at this point, we want to look at emergency response. Everything we are going to be discussing from now, please, I want us to understand that it is not only stopping in the hospital setting or stopping in the care home. No. By virtue of the fact that you are a CHCA, by virtue of the fact that you are a medical practitioner, you should have basic first aid knowledge. Very important. You should have basic first aid knowledge. In fact, people that don't have, like we had the mental health awareness certificate that we attached to you, there's another very important course, which is CPR and first aid, basic life support. I don't know the number of people that have that. If you don't have, it is important. I'm not trying to say you must take it with Andy Smart Solutions. Of course not. You can take it anywhere. But it is important to give you that edge that you are looking for, because a CHCA, a medical practitioner, you should be certified. You should be able to carry out CPR properly. You should have a certificate certifying you to be competent in first aid and CPR, or in giving life support when there is an emergency. So these things are very important. We have tried over the years to incorporate it into our trainings, but the end result of it is that it is very, CPR, first aid on its own is very broad. If you want to look at first aid training alone, can take over 5 days at a stretch. If you want to go in details to have the standard first aid training, that's how it is called, or BLS, that's basic life support. So it will take time. So, but it is important. Now, there are different types of emergencies, like we can see. Obviously, we know that in an emergency, prompt and effective response is key in any emergency. Fast, it happens fast. Many people that have slumped in church, that have maybe had the issue of maybe clutching their chest and falling, perhaps would have lived, that have ended wrongly. It's because the right knowledge was not there. It's because they did not act fast. So we have different types of emergencies. We have the medical emergencies. We have the trauma emergencies. We have the environmental emergencies as well. The medical emergencies are like cardiac arrest that I just talked about, respiratory distresses, strokes, allergic reactions, and a whole lot. These are things that there are medical emergencies. We have the trauma emergencies, like falls, just like that lady, Martha, I told you about, happened to her, falls, fractures, lacerations, head injuries. All these are different kinds of emergencies that we can likely have. Then we have the environmental too, like fire, like floods, places that are prone to flood, hazardous material spills, electrical emergencies. These are environmental emergencies. So we have different types of emergencies. It is important that we note that. I'm happy we are up to 18 on the platform. Thank you for those that have just joined us now. So now, this particular training is broad. Like I said, it will cut across. It would help you if you can just take time to follow me, and then you go back and do your background work. And tomorrow, you endeavor to be there because, like I said, tomorrow we have experts that are really going to dissect CPR. They will just give you the way it is. You see it live, practicals. I pray network favors us. So anything you can do, those of us listening to my voice, you can do to ensure that your network is top-notch tomorrow. Please do, because ours is always, we don't have any crack. But what I can assure you also is that we would have the recorded versions. But me, I always like you to be there so you can ask your questions firsthand. And then, you know, it's always more interactive when you are actually live there present, when it's instead of you getting the recorded versions. So emergency response can happen to anyone, and it can happen anywhere. Like I like to tell people, it can happen anywhere. But before you can give help, you must be able to recognize that it is an emergency. Because if you are not trained, if you don't know, you cannot recognize that this is an emergency. There are people that maybe walk and see that woman fall, and if it's not in the hospital setting, maybe it's in a house, maybe in a house environment, in a residential facility, where maybe just the person is there, and maybe a person that doesn't know may just walk and see the person fall and will not know what to do immediately. But as healthcare practitioners, we should understand, we should be able to sense emergencies when we see them so that we can apply first-hand knowledge of what we know about it and help as much as possible to save the life of our patients. First aid, we are going to get to that. Let me not say that. So there are some examples of, or there are ways you can recognize emergencies, maybe unusual noises, maybe some form of odor, appearances or behaviors. There are certain things that you can use to decipher that there's actually an emergency. Please, are we together? Can everybody hear me? Like I like to
Yes,
ask,
ma'am.
not be
Yes,
talking
ma'am.
myself, because I can talk, or those that know me know I can talk.
We can hear you.
And continue till I will not. So please, I will have to be asking. So like I was saying, emergencies happen. You know, it could be from maybe unusual noise that you were hearing. Like I heard that sound. Oh, there's something. What is that sound I'm hearing? And I rushed to that particular word as at that time when I was moving around. So these are some of the things that you would see. Now, these are some of the unusual noises that you can see. Screams, you can yells, maybe someone just screams for help or yells, moans, calls for help, breaking flashes, crashing metal, screeching tires, sudden loud voices. There are things that can captivate your attention. Maybe you are somewhere, you just hear that particular sound, something that is out of the ordinary. Immediately, your instinct tells you that something is wrong. We may not understand the importance of us actually having this training or actually being a CPR certified healthcare worker, because many things in life we take for granted. But if you have experienced an emergency situation, understand firsthand what I'm trying to say, you will know that I'm not just talking. You will know how it is. And sometimes we flog ourselves. I know a couple of things have happened to me before I had the knowledge, the right knowledge, that I say, oh, if it was now, I would have done like this. I know it has happened to a couple of us too, as we are getting these trainings or when we keep upgrading ourselves. Sometimes something happens, you say, is this just what I would have done? Oh, I did not know. That's what comes to you. That tells you the importance of knowledge. So sometimes these are some of the things that could make us be conscious to an emergency or be conscious of an emergency situation. Now, unusual sights too, maybe a stalled vehicle and overturned pots, you know, we have to be very, very sensitive. There's something in Boy Scouts that they say, be prepared. Be prepared. Those that are in Boy Scouts, the men can relate to this. That is their motto, be prepared. Because as a scout, you have to be prepared at all times. Anything can happen. So you have to be alert. You have to be alert. By the grace of God, I'm a member of International Red Cross. So they teach us something. Be alert. Wherever you are, let your alertness be top notch. Because if you are not alert, certain things can go under, can happen without you being conscious of. So you have to be alert at all times, regardless of whether you're in the hospital or in your house or at your home. So a spilled medicine cup, container, maybe broken glass, electric wire, smoke or fire. You may just sense smoke or something unusually or abnormally coming out from somewhere that you realize is unusual. Look at it. Seek to know what is actually happening. So these are some of the things that we need to understand as healthcare practitioners. Now, as a first aider, there are 3 basic steps you can take when an emergency occurs. 1, check. We tell first aiders something, that you need to be safe in order for you to keep another person safe. As a CHCA, you have to be healthy, you have to be safe, you have to be free of illnesses and diseases, you have to be well, let me use that word. Your mental health has to be intact. Why? So that you'll be able to lend that hand. You'll be able to provide that adequate care to a patient. It's just like a teacher that is going to teach. If your mind is not at rest, if you are worried about something, then it will eventually get to a situation whereby as you go to work, a child can just come to you and tell you, and you just snap, you shout, or maybe you just snap, you just lose it on that child. You transfer aggression. So it's important that as healthcare practitioners, we should keep ourselves well. Our safety should also be paramount to us. Let it not be because we are saying, okay, you are helping people, care for people, this, and you lose guard of your own self. That's what I tell care workers every day. I keep having this training. Look out for your own welfare because you're actually important. The fewer people we have vulnerable and maybe ill and having challenges, the better it would be for us. So what do you do? Check first. As a first aider now, we are talking about first aid. Now, 3 steps. Check if the scene is unsafe. Remember that dead heroes are no help to anyone. Remember that you cannot be a hero, God forbid, on the other side. You can only be a hero on this side that we are. On the other side, you cannot be a hero. So, first and foremost, check. There are situations whereby, let's like I said, that this first aid is not going to only center around the hospital. So I'm going to be digressing to other scenarios as I progress, so you'll understand. Now, if there is an accident, like we are going to have tomorrow when we have the practical, you are going to listen and see the things you need to know. When there is an accident, I have seen severally, maybe in the course of maybe coming back from maybe one place or the other, you find out that maybe there is an accident in front of you while coming back. And you see that a whole lot of people there, they are very dangerous objects and things around them. Everybody's just like shouting, go and call this, oh, run here, oh, pick there, oh, so much. If any of you, if you have seen an accident scene, you understand what I'm saying. That 3/4 of the people, they are actually people that don't know what to do and people that will not even do anything in the face of that particular emergency. So as a first aider, it's important that if you come face to face with such scenarios, you have to first of all ensure that you are safe. Ensure the scene is safe for you. If the scene is not safe, we advise be mindful of whatever you do. It's either, like you will learn tomorrow, is either you take the casualty away from the danger or you take the danger away from the casualty. You are going to be hearing me say casualty intermittently because in first aid, we refer to them more as casualties than patients. So, however, you hear me say casualty or patients, I'll be using it together interchangeably. You get to hear that. So, ensure that you are safe. The scene has to be safe for you to actually carry out what you know how to do best. The next thing, call. Do not hesitate. Make sure you put a call through. That is very important. You put a call through for help to come before you even start, because you are not, take note, you are not a medical practitioner in the case of first aid. We have first aiders that are medical practitioners. So if you are a medical practitioner, fine and good. That means you are combining your first aid knowledge with your knowledge of medicine. of the fact that you're already a practitioner, because we have people that just have the knowledge of first aid and CPR, and they're not actually doctors or nurses or directly in the clinical, working in the clinical aspects. So these are some of the things that we need to actually understand why we handle this issue. So call for help is very important. Alert emergency services. Let them know. Alert them. Let them know we are going to get to see other things as we progress. And notify your healthcare team. Provide clear, concise information about the situation. You know, when something happens, you can be jittery, you can be unsteady. That's why we talked about calmness. You have to put yourself together. Do not behave like those that don't have the knowledge. Put yourself together, call, do the necessary things, give clear information about the current situation, because you may be talking to paramedics, you may be talking to the emergency department, so they have to know concisely and clearly what is actually going on and how they can be of help to you before they actually get to the scene of the accident or the incident. So another thing is provide care. Administer first aid as needed. That's where CPR and all these things come in. As needed. That is to say that since you would be vast with the knowledge of what to do and how to carry out CPR, you should be able to know what to do in such a situation. You know when you should administer CPR to a person and when you should not. Very important. Not a person breathing, a person maybe just has a wound or two or so, you just delve straight to say, oh, CPR because I'm a first aider. No. So we need to know these things. As we progress, we are going to learn them. And monitor and reassess, very important. Continuously monitor the patient's condition and reassess as necessary. Be prepared to provide updates to emergency responders when they arrive. Be ready to provide information as to when they arrive. Okay, this is what I have done. I've been carrying out CPR, or this is what I saw. This is how it's happening. Be there handy to give the necessary information that they need. So that being said, that is primarily some of the things that we need to know. Then emergency equipment too and resources. We have the first aid kits, which we would see tomorrow. We have a whole lot of things in the first aid kits that would help you in when you come face to face with an incident or an accident. It would help you a lot. We are going to see it tomorrow. Ensure accessibility and proper supplies. Don't just carry. I've gone to a couple of places for checks, my routine checks, and I've seen that in most of the hospitals, in most of the facilities, they have the fire extinguishers, they have the first aid boxes, but some of them are actually equipped. You open the first aid box, assess it, and see that most of the equipment and the materials that are supposed to be contained in a first aid box are actually there. Then you also have scenarios where you go and then you don't see the materials. They just showcase the first aid box to fulfill all righteousness, like I would like to say, just for them to be ticked present. Oh, they have a first aid box. Oh, yeah, that's good. They tick and move. But the actual fact is that the contents in the first aid box is not there. Some of them, they have the contents, but they don't know how to use them. They're just there for fun, just to beautify the box. And then when someone opens it, and then we also have situations whereby there are fire extinguishers too, that people don't even know how to use it. They just know that we have locations for fire extinguishers, not only in the hospitals, in facilities, workplaces, hotels, business centers, and a whole lot. We have fire extinguishers, and even in cars too. A whole lot of us that have fire extinguishers in our cars. If I carry out statistics right now and say, okay, please, you have fire extinguisher in your car, do you actually know how to use it? Of course not. I am a victim of that. I was a victim of that. I actually had a car where I had my car. I have the fire extinguisher there. I have everything. In fact, anytime I am stopped, they say, oh, they don't even waste time. They just say, okay, madam, you can move. But the real sense is that I don't know how to use it. I'm just being very frank. I never knew how to use this at that time. So these are some of the things we need to know. Those madams, like I know we have so many here. And Oga has a car. Please, let's help ourselves. Let's help ourselves. So, Ejo, Emma Bino, let's help ourselves. I don't know, Ejo. So, we don't know how to use it. So, please, if we have cars with fire extinguishers, so we should begin to learn. how to use them, because emergency can happen anytime. Then we also have automated external defibrillator. What is it? A defibrillator is a machine that is used to shock the heart. It's used to shock the heart and bring it back to function, to act in its normal rhythm. That is an AED, automated external defibrillator. That is what AED. Familiarize yourself with its location and operations too. It is very important. We need to see how that is used. It's a very expensive machine. It's expensive. So it's not easy for people to have it in residential facilities, but in big organizations, they have AED machines. It's around. So it's one thing to have the machines there for compliance sake. It's another thing to know how to use it. Emergency contact numbers too, which we are going to have, but we would have all the numbers. Keep a list of them so that when something happens or in an emergency, you can easily pick your phone and do what you have to do. That shouldn't be the time you say, oh, please, can I know what's the number? And no. As a healthcare practitioner, one of the things you should have, the tip of your fingers, is the emergency contact numbers. And then fire extinguishers too, have a good knowledge of how to use them. That being said, I don't know if we have any question. Do we have any contribution? Remember what I said, and I like to do. If you have any issue, not issue per se, you have any comments or any contribution, nobody, I repeat, no one is an embodiment of knowledge. I am not one. I'm not an embodiment of knowledge. So I learn a lot of things over the years. I have built upon my certifications, built upon my qualifications and everything. I build upon it's based on the things that I get to hear from other people. Good. So now, do we have any question, any contribution? Can I go ahead? Oh. Hello, are we together?
Ma, go ahead, ma.
Yeah, together, ma. Go ahead, ma.
Go ahead.
Yes, ma'am.
Okay, thank you for those responding, because like I said, I've had, I know how it is, especially with us mothers. So I've had situations whereby some of us just keep the gadgets and say, oh, Dr. Mrs. Dorothy should keep talking. She should just keep talking. After all, we've paid her money to talk, so they just go and help themselves. So please, please, let's move. Thank you for those that responded and those that are thinking of responding as well. Thank you. So let's continue with what we were doing. First aid. What is first aid? Like you can see there, first aid is actually the immediate care, treatment or care that you give to an injured person before the arrival of medical practitioners. Simple. The immediate care that you give. So in any way it is, you can decide to align with this, my definition, but me, I don't like reading things exactly from the slides. I have a whole lot of the meanings of hand. That's why. So first aid is simply the immediate care given to an injured or suddenly ill person. That's one. It's also the first treatment that is given to a casualty before the arrival of paramedics or medical practitioners. It still means one and the same thing. So you see that sometimes things can happen in your house. Maybe you are just in the kitchen chopping vegetables, and then in the course of doing that, your hand just goes like that, and you cut your hand and you are bleeding. Little things. As healthcare practitioners, we should know what to do. At that point, that's not when you should shout, oh, what do I do, or that and that. No, it's at that point, it's for you to know exactly what to do. So first aid is important for all healthcare practitioners. In fact, it is a prerequisite in most organizations that all the workers have to have a good knowledge of CPR and first aid. Likewise, in the health field, there is no way you can be a healthcare practitioner, whether in Nigeria or in any UK, Australia, wherever you may wish to go after this training or getting your certification, that it will not call on you one time or the other for you to have a CPR certificate. It's one of the things that is very important. So if you don't have, please do justice to that in that angle. Just do something about it. So first aid, like we said, is the immediate treatment. Self-help, it could be yourself, like I talked about chopping vegetables, maybe you cut your hand. It could be help from you, your own self, what you can do. It could be home care. It could be by a passerby, like I talked about the accidents, a scenario, or a first aider. Any of them can be through any of these four means. So when something happens, first aid is very important because it helps as much as possible to maintain that person till the arrival of the doctors or the paramedics, the people that will actually maybe, or not even the arrival, or the person reaching the hospital. It mustn't even be the paramedics coming there. It could be you trying to help save the life, because first aid, number one thing, priority, or number one objective of first aid is to, as much as possible, to save the life of a person. That is it. No two ways. Everything we talk about is towards saving a person's life. Be you a CHC in the hospital, is still saving, trying to help the patient's well-being, help the patient to live longer, to last longer, you know. So it's still the same thing a first aider does. Hence, you cannot detach first aid from the actual medical practice itself. Cannot be separated because they have the same objective. So, with such materials may be available for the relief of the casualty, that may be available. That is why you need to have, we have different types of first aid boxes. We have the small ones, we have the big ones. So as a healthcare practitioner, maybe from today, they are having this training when you eventually want to practice, whether practicing in your house or practicing in your neighborhood or practicing, you relocate, or maybe in any hospital where you are, please have your first aid box. It's very important. Every home should have a first aid box. It must not be that bogus one like we are going to see tomorrow. It may not be those ones, that's industrialized one. It may just be a little one, like you can see that purse, that small first aid kits down there. You know, it's very small, it's just like a handbag. You know, it's good for you as a first aider, in this case, to carry it about so that anything happens, you can have reach hands on anything that you actually need at the spur of the moment to save a person's life. So now, like you can see, this particular train is always beautiful because it's packed with pictures. I try to make it beautiful, colorful, and you'll also get to see the practical aspect of it. So, qualities of a good first aider. Observation, observance. I cannot overemphasize that. Alertness. I said that earlier on, alertness. Something cannot happen and you move. You say, oh, I'm in Nigeria. I have one particular first aider that we trained, International Red Cross. We trained some years ago that actually had the training, and she's certified. She's been doing a lot of community surveys, volunteering here and there, you know, but there's still one aspect of her that has made her not to go very far in that field. Because, you know, we know Nigeria. Those of us here, we already know how Nigeria is, that sometimes something can happen. You actually have the right knowledge, but you are afraid. No, I don't want to be a part of that. So somebody had an accident. No, I wouldn't. So I will not have problem with the police. I will not do this. I will not do that. It's common saying. It's something that is very common. People will want to shy away. They wouldn't want to be involved in it. Some will even pretend and drive past. Maybe there's an accident or something. They have the knowledge. They know what they can do to help, but they will just move away because of how bad the country is. But let me let you understand and know this, that as a first aider, because you are not Red Crossers, I wanted to say Red Crosser, I am a Red Crosser. So, but in this case, as a first aider and a healthcare practitioner, you owe every human being a duty to make use of that knowledge that you have acquired. You owe God, you owe this our God, that particular duty to make use of the knowledge that you have acquired, regardless of the situation. Yes, times are hard, times are bad, but when you have the right knowledge, how would you close your eyes and sleep knowing that you could have been of help to someone that you did not help? That is just the thing. And you have the right knowledge in this case. So I know we are very seasoned professionals here. I know that we are dedicated people. So it's absolutely not part of us to be like that. I just thought I should bring it here. So you have to be resourceful because there are times you have to improvise. That's what we call improvise. You create something out of nothing. That's improvisation. You create something out of nothing. Maybe something, an accident happens now, or there's a crowd. You are somewhere in the market or something, there is a crowd, and you look left, right, nobody's actually there to help. Like you as a first aider, you have to spring into action and do something. You don't have to wait until you have one very perfect bandage or very perfect you have what you need, perfect. No, it doesn't have to be perfect. In that moment, all you should think of, or all should come to your mind, is how to rescue that person that is actually having that challenge, how to relieve the person of the suffering, how to, as much as possible, save that person's life until actual help can reach that person. That is it. So even if it means you tearing your clothes, even if it means you tearing anything, at that point in time, what is more important is to stop that bleeding, or is to salvage the situation before it gets proportionately out of hand, before for the person to maybe something serious to happen. That is the most important thing of first aid. And you see, it aligns with your primary duty of being a certified healthcare assistant in the hospital. Everything is just intertwined. So you have to be tactful too, sympathetic, cheerful. We cannot overemphasize that. Cheerful, grumpy. You cannot be a grumpy first aider. You cannot be a first aider that transfers aggression. You cannot be a first aider that lacks sympathy. No. So these are some. You have to be happy. You have to be cheerful. Enjoy what you do. If you enjoy what you do, I tell you the gospel truth, you will do it perfectly. That's just the truth. Like I said when we started this training, I tell everyone that enjoy it. If you value human life, that's the first stage. If you value human life, that's one. Then two, you enjoy what you do. Then three, you have the right knowledge, because the right knowledge that will build your confidence. As you are enjoying that thing, you are part of your enjoyment comes from the fact that you actually know what you are doing. You actually have the confidence and you can do what you are doing. It comes from that. So these things are intertwined. These things are intertwined. You just have to be a happy person. You just have to be a jolly good fellow for you to be working in the healthcare system. That's just the truth of the matter. Like I see some people, some nurses actually, due respect to the nurses we have maybe on this platform, but I must say that some, not all, just a few proportion, some of them, you see them even when they attend to patients, their face is contorted, they are angry, they are transferring one aggression or the other. Maybe the government, especially in some hospitals, maybe the government has refused to pay them their salaries, and they are like, that aggression has been transferred to the patient. Oh, what do you need? I've told you what to do. Go and sit down and wait for the doctor. Or they just, attitude. Attitude is everything. If with the right attitude, you will go very far in life. Anybody that has the right attitude, I tell you the truth, you will go very far in life. So the attitude is not only in your home, it's cuts across everything that you do. Be cheerful, be happy, put life into, regardless of the economic situation, just keep moving. Just do what you do with fun, with happiness. And I tell you, it'll just be like a light that is put under a bushel. Yeah, it lights a lamp that is kept somewhere. There's no how. It will certainly go shine out bright. It will come out. It will break all the barricades and all the barriers and come out because it is light. So when you shine, when you are happy doing these things, I tell you, the sky will be your starting point. Not only, it won't be your limit, but your starting point. So these are things we need to understand. Patience is important. Common sense too, there is nothing you can do, though they say common sense is not common, but in caregiving, in health, in first aid, common sense has to be common because you have to do what you need to do. Sometimes you are not stereotyped to having the exact situation. Things can just happen. So common sense, you have to spring into action using your number 6 to say, okay, what am I to do right now? Because it may not be part of what you've been trained, what you know how to do, or something that will just come to you at that point. It is for you to say, oh, what do I do at this situation? Oh, if I don't do the leg like this, or if I do like this, the leg is going to be broken. If I, all these things, common sense. And take right decisions. That's self-explanatory. Always take the right decisions at the best interest of the patient at that particular point, because human life is most important. Human life is most important. Now, let me give you something that will take us a little bit from what we are doing. We've had an issue, like I told you, by the grace of God, I've seen it all. I like to say that in a very simple way. I've seen it all. I've seen the good, the bad, the ugly, the front, the back, the side. I've seen it all. So there are situations whereby we've had, in the course of us actually carrying out CPR trainings or first aid trainings, someone had asked this question that, oh, where I stay is in the core north, in the core north. Those of us that grew up in the north or know anything, you understand that in very places, they have stringent measures. There are certain things that, you can't just do like that. So he was actually asking that, oh, I'm a first aider, I've just been trained and I've gotten this certification. What if in a situation whereby I have to carry out CPR, I have to carry out mouth-to-mouth resuscitation, rescue breath on someone's wife that is unconscious? What do I do? I just laughed. When the question came, it was very funny because yes, I understand, because she mentioned the state and I said, oh, okay. So when I heard the state, I saw where the concerns were coming from. But I told him that number one, what is paramount at that point is how to save the life of that person. Because life is ultimate. Life is the most important. So when you have to do CPR, you have to do rescue breaths, please go ahead and do what you have to do. Because even the law covers you that since you acted in good faith, that's the word. That's the legal terms for that. You acted in good faith. So nothing can count against you. You acted in good faith to ensure that that person is there. So whether you carry your mouth and place in the mouth to the nose or to do this, and the end of the day, the husband came and arrested you and took you to cell or to do anything, the fact remains that anybody hearing it or legally, it is based on the fact that you acted in good faith. So there is nothing cannot counter. The most important thing is to save the life of the patient or the casualty at that point in time. So what are some of the do's and don'ts? Some do's is for, let's see, some don'ts for the first aider or do nots. That's some of the things that okay. So like I like to say, I would like to find out if we are together. You know, this is a first aid. I don't want to be a casualty because I've been talking and talking and talking. I don't want to be a casualty. So please, I need to hear the voice of people because that's part of checking to be sure that everyone is fine, that everyone is going ahead.
Okay.
So,
We're okay, ma.
okay.
Yeah, here, ma.
All right. Thank you. Thank you. So, okay. Thank you. All the beautiful mommies in the house that want to hurry and go and attend to their families. I perfectly understand. And for that, I'm just going to wrap this thing up as soon as possible. Trust me. Thank you for your patience. So there we have some don'ts for the aiders, for first aiders. Already is here, is self-explanatory. Do not attempt to do more than a thing at a time. Don't be multitasking. That is it. Don't want to do this. You want to do the CPR. I want to do the rescue. You want to. No. Assume the responsibility of a doctor or nurse. Yes, we tell every first aider, you are not a doctor. Especially if you are not a doctor first aider, because we have in first aiders, even in Red Cross Society that I belong to, we have a lot of medical practitioners there, nurses, doctors, good. So if you are not a doctor, as in you are not involved in the actual treatment practice, treatment is not within the scope of your medical in your jurisdiction, then don't do these things. But we have doctors that are medical, that are first aiders. So if you're a doctor or a nurse, it is fine. But if you are not, maybe you are a CHCA or you are a certified nurse assistant or you are on a supporting role, that you are not actually involved in doing the surgeries, doing those clinical duties, please do not assume the responsibility of a doctor or a nurse. Consider the casualty as dead until death is do not. These things are things that you should not. So you should not consider the casualty as dead until death is confirmed by a doctor. Sometimes I've seen this error done countless times. When maybe there is an accident or there is something and you hear them say, oh, the person has died. Oh, I saw the person lie on the road. Oh, he has died. Oh, I saw this, he has died. Oh, and I just wonder. A person cannot be confirmed dead except by a doctor. And in most cases, not even a doctor per se. A coroner has to confirm that, oh, this person is dead, certified dead by a doctor. And sometimes it needs a specialist doctor to even certify that a person is dead. Sometimes an ordinary pediatrician or just a GP, a general practitioner like that, sometimes It's not in all cases that they certify a person dead. So here as a first aider, maybe you stumble on somebody that is unconscious, the person cannot breathe. You cannot conclusively say that, oh, the person has died. Oh, I saw that person. You see, before I came, the person has died. No, until the person is confirmed dead. So do not. These are some of the don'ts. Show your emotions. Do not show your emotions, whether worry or excitement. Do not bottle up as a CACA. Bottle up your emotions. Bottle up. You know why? Because if you do not, especially maybe in an accident scenario, you don't bottle up your emotions. It's just like, I don't know how to put it. If you maybe you begin to cry, oh, you begin to do this, it will drift you away from the actual task that lies ahead of you, the task that you're supposed to do. And as a first aider, maybe in an event of an accident or something happening, you are coming there to be like the hope, the little ray of hope or glimpse of hope in such a situation. I don't know how. I used to be very passionate when I do this, and mental health, these courses really make me talk a whole lot because it just comes out of me naturally, because I've seen a whole lot. You see, sometimes something is happening to somebody and people are clustered there, they are shouting. I've seen such scenarios severally, and I wonder, people will just be there shouting, oh, a church, somebody slum. You see, the whole people, they don't even act fast. They don't even think of what to do because, well, some don't have the knowledge, some because they don't want to be involved. It's not me. Or before you know, they'll say I'm the one that killed the person. Hey, they'll say the person wouldn't have died if I did not come. Oh, this. I have seen a whole lot. So you don't, at that point, you are like the ray of hope that is coming. Oh, people know that, oh, Mildred, she's a health, oh, she can do CPR. She's in fact a CHCA. No, please, she's here. Oh, thank God, please, Mildred, what can we do at this? So at that point, you cannot be overly excited. You cannot be worried. You cannot be crying. Hey, people are crying, falling down. You too, you join the group, because that's not what you actually, and if you do that, then where's the help? At the end of the day, who is actually coming to help, or who is helping who? So try to bottle up to keep your emotions sometimes, especially when it is actually, I'm not saying you cannot show emotions. So as time goes on, we are humans after all, but try to handle it. I think handle is the right word. Try to handle it, put it under checks. Now, rebuke or scold the victim. This is another part that I want to talk about. Do not rebuke or scold the victim. Most of our healthcare people, they will shout, they will scold the victim. They will, didn't you see that? What happened to you? Didn't you see a car was coming? Maybe somebody is unconscious. Didn't you see? How did you allow your car to collide? Oh, and a whole lot. They will scold, they will rebuke, they will do all the basketballs before they eventually settle down to helping this person. No. It's not, because if you are empathetic, you don't even have to scold the person first. Like I talked about this when we had mental health. You have maybe a person that is into drugs. You have a person that you are trying to see how to change. The best way for you to change that person is for you to walk a mile into that person's shoes. That does not mean you should follow and take the drug so that you understand how the person is feeling. No. It means that feel what the person is feeling, understand. Don't scold the person. You this person, I told you to stop. Why are you doing this? You see what it has done to you? You see what it has cost you? You are this, you are useless. Like some of the parents tell you, are a useless child. It has, no. If you do that, you are making that person coil back into his or her shell. Especially if it's maybe a child mother, that child will coil like a snail. When you touch a snail, the snail goes back into the shell. That's what happened. That child will coil back. And I bet you, cross my heart, 100%, you'll never be able to get the best from that child. You'll not get a word from that child again next time. So people that know how to handle it, you don't approach it by scolding. Talk to that person. Let the person pour out, oh, I didn't know this. You begin to appeal to that person and attack it from another angle. Never use scolding or rebuking. I know that some of us are actually Nigerian mothers and fathers, but when you look at how the world is metamorphosing, you'll understand that doesn't. So that's how it works. Someone is having injury and you are adding salt to the injury. That's what it means. Instead of you to see how to help that person, maybe later, if you still person you need to scold, you can talk to the person. You can talk to the person later, remove victim's clothing if not necessary. Now, there are times maybe in the situation where a person is, you say, oh, you don't even know whether it's you don't even know, you just want to maybe remove the clothes because you learn that, oh, if someone faints, just remove the clothes, and the person will be, and you just remove the clothes. No, do not remove the clothes if it is not necessary. But as a first aider originally and already, you would know that it is important you will know if it is important, if the situation warrants that you free the clothes, you help to remove the clothes and the person, especially if it is a lady, especially if it is a woman. You know, we have some of these things. So you only do what you know that is extremely necessary. Now, do not give victim anything by mouth if unconscious or severely injured. These are some of the things we'll learn tomorrow. This is the practical aspect. Apply wet dressings unless so specified. So there are things we have to like checkmate and
on ṣe lọ. Speaker mi ló ní issue.
Oh, sorry. Who is having speaker issue? I guess Abidemi Bele. Okay. I just wanted to be sure which
His
slide
network.
Okay, she's saying it's network. Sorry about that. All right. So at this point now, like I said, we would have our break by 6:40. So let me see how we can move. 6:40, we'll take our normal break to stretch our legs so that we don't have casualties or have any incidents, especially most importantly for this training of first aid, we have to really go and stretch our legs. So we get to CPR now. CPR. Please, are we together? Can I go ahead? Any question? Any contribution?
Here with you.
I have a contribution.
Okay, thank you. See, I need contributions. Please go ahead. Who wants to contribute, please?
It's Mildred.
Okay, Mildred. Thank you, Mildred. The floor is
The
to you.
contribution is like I don't know whether I will call it negative or positive, because like
The victim
since I've been
anything by
listening
mouth.
to you about the first aid,
Mm-hmm. Please go ahead, Mildred. I lost you. You've muted.
hello, can you hear me, ma?
Yes, I can hear you now. You mute yourself.
When there is an accident,
Mm-hmm.
people find it difficult now to attend to give first aid,
To
even though
casualties.
without to casualties,
Mm-hmm.
because of what they experience. Because
Mm-hmm.
when you try to give that first aid, because what I see them do now is they will video to see what they will post on Facebook, and somebody will die.
Mildred, yes.
Yes, exactly.
That's what I see.
Yes,
And
yes, said to help.
secondly, if you try to take the person to the hospital, that means your journey have ended there, especially on the express. Maybe you are traveling. Because the hospital will hold you down, you will not move. They will tell you to fill it. After filling the form, they say no until the family of the person arrives. Because they will not be suspecting whether you are the one that even hit the person
yes.
or that had this. You understand? So now, I'm talking about our country. That's what's happening. So I want to, maybe you throw more light on that, because it's rampant. Now, even neighbors, if there is anything happening in the next house, oh, let me not go there. Let them not say I'm the one. That's what we experience now. So first aid is not really like easy. Okay, especially in Nigeria, because some people got drowned. They were supposed to be alive if they were taken to the hospital immediately.
Beautiful.
But they allowed them, instead they were videoing and snapping,
Mm-hmm.
shouting, hey, they are dying, oh, they are dying, oh, they are dying, oh. That was what they were saying, instead of them to rush them to the hospital. We even had a case where they took the person to a native doctor. They said it's the one that appears
I'll
the
give her
river.
200.
Can you imagine?
Please, excuse me. Temi Tokpe, please help us. Go ahead, Mildred. Go ahead, please.
We had a situation not quite long where instead of taking the guy to the hospital, he would have survived. They took him to a native doctor that appeals the cause of the river. In this our generation, graduates that have gone to school. So I want you to throw more light on that as we are progressing, ma. Thank you. Because it's very difficult, especially when you take somebody to the hospital. They will not.
I understand.
Keep you there. They will not want you to go. And if the person dies, that's in fact you are finished. Police will come. They will pick you. So how are we going to address this now in our own country? Because it's not everybody that will go out at the end of the day.
That's
Some
correct.
people will still, some people will go out and still come back here
Mm-hmm,
after
mm-hmm,
retirement over there. You
mm-hmm,
still come back to your
mm-hmm,
country.
mm-hmm,
I can tell you that 80-90% they come back.
Of
So when
course,
you come back, you still want to continue.
of
So
course.
these issues have to be addressed, man. Maybe
Thank you.
there's going to be a lot of public this thing. You that
Awareness,
are
yeah,
already
yeah.
certified,
Yes, yes, yes,
awareness, and
yes.
especially to hospitals, general hospitals, private hospitals.
Mm-hmm,
When somebody
mm-hmm.
brings a casualty, please just give the person a form to fill, get the person details. The person can now go, or the person can help to get the family of the person, but allow that person to go. So that's why on the express when people are traveling from Benin to Lagos, there will be an accident. Make I dey go. If I reach hospital now, I will not continue my journey.
Mm-hmm,
Somebody will die.
mm-hmm.
I've seen it happen, man. I don't talk about
You
this
are
story.
right, Mildred, you are right. You are very
Thank you, man.
correct. Thank you so much. You see why I said I missed you on the platform? I really, really did miss you. Thank you for that contribution and what you have just added. You see, it's a big issue. It's a big challenge. Well, like we know, what you have said is very correct. It happens when there is an accident, because accident is easier to relate to. When there is an accident, you see a whole lot of people flock there. Some don't want to render help, as you like you said, there are a whole lot of, the only solution to that is the awareness that you have talked about, creating the awareness. And how do we create this awareness? In our own little ways. Of course, you know, our dear country. Well, I don't know, but our country is a very good one. It's a very good country. Let me be ironical in this case. It's a good country, yeah. So, a lot of things happen. A lot of water has gone under the bridge. These things you are saying happen often. It happens everywhere. It's a challenge that each time Red Cross, we used to have conferences, international Red Cross conferences where people actually come, American Red Cross, they come. These are the challenges that we have and even the first aiders, the Red Crossers that we have, that we work with, there are some people that will not even want to volunteer because we have volunteers. Why? Because of the hazards that are involved. There are hazards to every job. And I guess this is one of the hazards. If we are able to maybe create awareness, be able to maybe reach out to people and people become aware, it's going to take a while. I must tell you, it's not going to be easy as a walk in the park. It's not going to be easy because so many people's mentality has been stereotyped because of what they have seen happening. Even those that have not experienced it firsthand, they have heard it. You know, they'll say, you want to go? No, you are on your own. Or when the police gets you, they'll say you are the one, you know. So even by extension, the people that are not even actually involved in the physical, involved in the scenario of actually being there when that thing happened rather, or wanting to help, other people by extension will get to hear the feedback of what happened when a person tried to help. So you see, it's like fire that is like someone setting a fire in a bush where there are dry leaves. You know what happens. So that's how it keeps spreading and spreading. So as it stands now, that particular challenge has been on the tables of those people that matter. But we've looked at it also. It's something that has to be a holistic form of awareness, because the police to need to be brought into the picture. They should understand that this is the law. Even in anywhere there are laws. Even in a lawless place, there are laws. So the law states that if you help anyone in good faith, you should not be exposed to any hazard or any suffering because you are helping the person in good faith. That is the legal terminology of that. But how many people even stop to think of that? Our legal people people in the force, the force men. How many of them actually want to understand or to look at it in that angle? Because they too have their own rules. They tell you once or twice, we've been able to do this kind of awareness. They tell you that their own job, they also have their own policies, that is the policy. When you bring a person in, you cannot leave the person for any reason until the person's family member is brought at least one of the persons. Aside you leaving the person, what about the aspect of the people that are actually rescuing the casualty to turn out to become the accused, or maybe accused of actually carrying? So it's a whole lot, Mildred. It's a whole lot. What you have said, I must really commend you for bringing that up, even though it would have been one of the things we would have said maybe much later if we remember, if I remember in the course of me talking. Remember, Beth, you have done so well. It is a challenge. So maybe we'll see how to, in our own little ways. That's why the more health workers we are able to maybe train, are able to be involved in health work, the better it will be, that have the right knowledge. You can talk like you now. You have a community. Maybe you talk to your people. You create some form of awareness. Promise does has. Osareme does has. Helen does has. At least we're about 20. How many here? The little we can do, just as we talked about that mental health, we keep spreading. I in my own little corner, you in your own little corner, and at the end of the day, we would be able to, though it's going to be difficult, I must tell you, because this is Nigeria. It's going to be really difficult. But what I believe is that life is the ultimate. So regardless of the hazards, what we should look out for as medical practitioners is the health and the safety of anyone that we can help. Anyone that is within our reach to help, we should help, because life is the most important. So I think that having said, we would see how to maybe create awareness concerning that. We have been doing it because, like I said, we used to have Red Cross conventions. We used to have in IRCS come here. We've been doing a whole lot of work, but it is not easy because you have the police to look out. You have the drug law. We have a whole lot of it. It's just intertwined at the end of the day. But I know that someday we'll definitely get to it. Someday, if we do our own in our own little way. So that having said, thank you so much, Mildred, once again. Let's quickly look at this cardiopulmonary resuscitation. CPR. Cardio, like we can see, is the heart. Pulmonary is the lungs. Resuscitation, bringing someone back to life. So that's the combination of the three. Very important. There is no health training course. There is no board exams, be it CACA, be it CNA, be anything in the health sector, that CPR does not come in. So I think that's number 2 expo I am actually giving here. So cardiopulmonary resuscitation is a technique, like we talked about, that we are going to see tomorrow practically, that talks about how to save a life. Is a technique that is used in many emergencies for someone that is maybe near drowning or has a heart attack, or the breathing or heartbeat has stopped immediately. To sustain that person's life is to carry out CPR immediately. And it recommends that every untrained bystander and medical personnel alike begin CPR with chest compressions. Untrained bystanders. What do we mean by that? That is to say that anybody, whether you are trained or not trained, but you have at least the minimum knowledge of how to carry out CPR. You are not a medical practitioner. When you see a person having a heart attack or the breathing has stopped, taking note of all the other details that we are going to see, immediately administer CPR. Because what it does is it helps to bring back the heart. The heart begins to have a rhythm of beating back. We talked about anatomy and physiology some time ago. We talked about how the heart works. It pumps blood. So any attempt for there to be maybe a blockage as a result of maybe you having a heart attack or maybe a cardiac arrest, it's a blockage or interruption in the blood flow in the heart, it results to unconsciousness, or it results to a deviated pattern in your breathing or in your heartbeat. So what CPR does, it helps to kick back your heart and bring you back, at least maintain stability until that person is actually attended to properly. That is CPR. Please, let's take note of that. Okay, now, again, it's important I say this, that it keeps the oxygenated blood. This CPR, again, does another thing. The blood that contains oxygen, that is oxygenated, flowing to the brain and other vital organs in your body until medical treatments can restore, just like I said, can restore your normal heartbeat. So when your heart stops, the lack of this oxygenated blood can cause your brain to damage in just few minutes. You see the importance of CPR. Before you say, let me go left, let me come right. Oh, what should I do? Oh, should we lift him up? Should we do this? Time is ticking, the clock is ticking, and the person can just pass. So that is why it is important that every medical person knows at least CPR. So that between the time help actually comes, you are able to put that person, restore the heartbeat of the person to normalcy, or make the person still hang onto the thread of life until medical treatment arrives to restore that person's normal heart rhythm. That's the importance of CPR. Many people don't know. But thank God that we are healthcare practitioners here. That is the main essence. That's why you hear CPR, CPR, CPR. I've had training. Some people don't even really actually know what is this CPR. Here, just do CPR. No, the main essence of doing it is blood, oxygenated blood, to move very fast. So that your rhythm, your normal heart rhythm, if you touch your heart, you hear your heart rhythm. And so when there is an alteration in the normal heart rhythm that God has created you to have, it becomes a problem, either heart attack or cardiac arrest. That's why you see some people that clutch their heart, my heart, and before you know it, they have gone, because nothing is actually done within few minutes, at least 8 to 10 minutes. Okay, what is the CPR? You know, I'm just going to try to just go over it. If you have questions, put it. Tomorrow, like I said, we start our practicals. You see the CPR, you pause, ask your question. They'll show you how to interlock your hands, how to do. It's always beautiful when we do the practicals, and you would see those that had challenges with, oh, how will the practical be? Oh, I need the physical training. I need this and need that. At the end of the day, they always give different, they have their mind is being reorientated towards not only having a training, physical training, they will also see the other side. So this CPR actually combines rescue breathing, mouth-to-mouth breathing, and external chest compressions. Resuscitation refers to reviving. Okay, I already talked about that. Reviving a person, resuscitate. Now, when do you carry out this CPR? When there is no breathing, when a person, a casualty, is not breathing, or a patient, when there is no pulse, like we talked about pulse. You will also see pulse areas in the body, all the pulse areas in the body. Tomorrow we'll see it, we'll touch it, we'll feel it, and you too will also know. So that in case there are some people that are very fat. So if you want to look at some certain pulse areas that you know, you may not feel their pulse. So all these things we would talk about it tomorrow. Now, our body has its own percentage of oxygen, and the air that we breathe in contains 21% oxygen, and the one we send out is 16% oxygen. So we can actually save life if it is blown into the casualty's lungs. That's artificial ventilation. Now, if the pulse is absent, artificial ventilation must be combined with chest compressions. You will see it, interlocking of the hands and on the chest. Otherwise, oxygen will not reach the body's vital signs. We'll see it tomorrow when we actually carry it out physically with what we are going to do. We are going to see it and learn more. So giving the heart compressions, this ones, I just had to ensure that you have these slides so that you can have a backup, something to back up reading for your exams. But tomorrow we would show you the chest compressions. I just needed you to have it in black and white. Hence, I gave you this slide. So you kneel behind the casualty, locate the breastbone. We have a video that will teach you, that will show you, just a very short video that will buttress what I'm trying to say here, because as I'm saying, you know, it's just a theory. I'm just talking and you're not seeing it, but tomorrow we'll get to see it. Place the heel, the sternum or the breastbone. Place the heel of your hands on the breastbone, and the other hand, interlock your fingers and actually do the chest compressions. Now, 30 times, and then give 2 rescue breaths, 2 breaths. The ratio the same for 1 person CPR and 2 person CPR. What we mean is 1 person actually doing the work, or 2 persons is the same ratio. The ratio for children is 30 compressions to 2 breaths. Tomorrow also, you also see how you can carry out CPR for a baby, for an infant. You see how to carry out CPR for a baby, and different ways you do it, because you cannot, a baby that needs CPR, you cannot interlock your hands and give the same centimeters of chest compressions you give to an adult. It means you want to kill the child. So these things, we are going to see them practically played tomorrow, God willing. Okay. We also have giving mouth-to-mouth ventilation. I hope we have not reached 6:40. Okay, it's almost then. give mouth-to-mouth ventilation, you know, with the casualty lying flat on his or her back, remove any obstruction, open the airways, blow into the casualty's mouth, and so on. And so forth. These are the steps for the mouth-to-mouth ventilation. I had to put it step by step so that you have the slides. Tomorrow we'll see the physical aspect of it. The reason I'm giving you this slide, like I'm talking about it, is when we will do the practicals, you already have the idea. For those of us that just moved from another sector into the health sector. Okay, so these are the steps. If there is no pulse, this means the heart has stopped beating and you'll have to provide an artificial circulation by means of chest compressions, pinching the nose and doing all whatnot. This is the step-by-step way of actually giving mouth-to-mouth ventilation when there is an incident. Okay, I'd like us to watch this video before we go for that break. It's just to get to see what is actually going on here. Some people get worried about what if I crack a rib during CPR, you know, maybe I'm doing the chest compressions. What if one of the rib breaks or something? You know, ribs definitely heal. You understand? So don't worry about cracked ribs. The most important thing is to help the person to stay alive as the need arises. So like I like to ask, I want to know if anybody can. I like this video a lot because it's practical. I took time to actually put it together. So I like to use it often when I talk about CPR. I have others as well. So please, I'd like to know if we can hear this. I'm going to play it and I'll need your feedback. Please, are we together? Can we hear?
Yes. Yes, ma'am.
I'm here, ma.
Yes, ma'am.
All right. Thank you. I was trying to drink water, so I'll not be dehydrated. Fine. So let's see. Okay. Is it audible?
Yes, ma'am.
Increase the volume.
No, ma.
Yes.
No, ma.
No, I need to
Yes, ma,
know, please, if we can hear, because if
Increase
we
the
cannot,
we can hear you, ma.
let me see what is happening. Just give me a second. Let me see. Okay. Now, please, I need to know, because without volume, it's not making sense. Let's go. Is it audible?
Yes, ma.
Okay.
Yes.
Oh, I had to move it to another slide. Okay. All right, so let's go. Let's just see.
It's not audible.
Can everybody, is it the same challenge everywhere? I'm hearing it's not audible without it being
It's
audible.
not audible, ma.
Audible, ma.
And I've been playing it. Nobody, let me see what the challenge is, so please. Because without the volume, it doesn't make sense.
Yeah, let's go. Wait. Okay, you know. It's like this. No, look at it.
Let me call and confirm. Okay, please, I need a feedback.
It's not audible. We're only seeing the. We're
Picture.
only watching
Is
the.
it audible now?
Not really, ma.
Not
Ah,
at all.
whoa, Jesus. What's this? You shouldn't stress me. Let me see. Hold on, please. Let me look at volume. Oh, okay. Okay, let's try and see now. Should have a different Okay, what about now? Is it better?
Yes.
Yes,
Better.
ma'am.
Yes, it's okay.
Okay.
Yes, yes.
Okay, so let's start. Thank you for letting me know. Okay, so that's having, I think we were able to see that. Were we able
Yes,
to
ma'am.
learn one or two things from that? So
Yes, ma.
before we go for the break, I would want to just one question before we go, so that we know we are back 7 o'clock. So what is the first thing to do when we want to attend to a casualty, or rather from the video we watch, what is the first step? What was
You
step
call
one?
108.
You call emergency number.
You call emergency number. Thank you. So that's to say that because we are not doctors, so if you call the emergency number earlier, you are sure that before you finish doing what you are doing, certainly help will come, especially like in a country of like us. help will definitely come to you. That's good. So after the call, what is the next step? Who can tell us what's step 2? Step 2 was
The
what?
next thing,
Yeah, I was hearing
The
someone
next
say,
thing is to check if there is pulse, if the person is
okay,
still breathing.
okay, to check if there's pulse. So I wanted to know if you are excellent students, and I have actually come to the conclusion that you are. If there's anything more than excellent, you are all more than excellent. Thank you so very much. Let's take our break now, and we will come back. But when we come back, somebody will tell me the last step. I don't want to ask now. Now is 6:47, or call it maybe 6:50 plus or minus. So exactly 7 o'clock, we should be back to complete the remaining slides. Thank you so much for that. Let's take our 10 minutes break. Please. Yes?
Ma,
Are we?
it's Helen.
Okay, Helen, did you have a question?
Yes, ma. I'm pleading. I want to plead. Can the video be played again? Maybe when we come back because I was a little bit distracted. Please, ma.
Hey, Helen, did you have a question? Ellen, I don't know if the house will unanimously agree. What we will do
That
now?
you won't mind to watch it again.
Helen,
Okay.
okay. All right. So we'll watch it again when we come back. Let's take the break.
Thank you, ma.
Thank you,
Thank you,
everybody.
thank you,
Thank
ma.
you, ma.
Thank you, ma.
Thank you, ma.
You are all welcome. Thank you
Thank you.
for thanking me. Let's go for our break. I'm trying to see where to have it muted. Okay.
We're coming back 7.
Yes,
Hello, ma.
please.
Okay, ma.
Yes, please.
Thank you, ma.
Hi. Hi. Able to and stretch our feet. Okay, so Helen, are you here? Because you specifically asked for this, so I want to be sure you are here. Hello, Helen. You see, Helen isn't even here now, so okay. We still have 16. Some people are still yet to join us.
I thought you said we are doing practical. We are starting practical tomorrow.
Yes, please. Yes.
Can't we skip this video? Is it not part of the practical later? Or
Well,
this one will not come again?
since we have already said we were going to, it's not going to take time.
Okay.
It's not going to take time. So let's just, since we said it, to do it before the break. Thank you for understanding. Hello, Helen. Okay, if you are not here, then I think I just have to move it because it's for your sake that we should have done this. Let's see if you are on the platform, and then if not, we move. Okay, obviously, Helen isn't here.
Helen is here. I'm here, ma.
Okay, Helen, I've been saying Helen. Everyone was just waiting for me. All right.
I'm here, ma.
So, all right, you're welcome. So let's just quickly, as fast as possible, see how far we can take that video again. I hope.
It's on rotation already.
Okay, the audibility, is it audible?
Not
No.
yet. Not
No,
yet.
ma. It's here first. What is it? Distract somebody. Point me here.
Let's get back to it properly now. Because as you are eating and talking, the food can go down the wrong way, and then it results to choking, can go down the wrong way and block your throat or your windpipe, which will result in you having that issue. So young children often swallow small objects too, like those of us that have children that are toddlers, that are still babies, they pick things from the ground and then put it inside the container. Yeah, like children, young children that often swallow maybe small objects, in the course of running, because choking cuts off oxygen to the brain and then gives first aid as quick as possible. That's what you should do. Because when someone chokes, you can imagine a scenario whereby maybe there is no first aid out, there's no knowledge, and then either be it in the hospital where you have the patient, good in the hospital because we have a lot of medical people around there. But if it's in a setting whereby maybe nobody is there, that's why first aid, we move around. When I have my vacations, I like to do a lot of first aid, sensitization, creating awareness, doing a couple of things. I just like to do it. So sometimes I move around schools and I tell them, no matter how small a child is, the child can have knowledge of first aid. A child, secondary school level, as mothers, as fathers that we are on this platform, let your children have basic first aid knowledge. Take, for example, maybe there is a choking situation and you, the mother that is the certified healthcare assistant, God forbid, or the father that knows what to do, does not know what to do. So you see, it would have just taken someone that has the right knowledge to know what to do. So these trainings are not a broad, how do I put it? Like you just gain knowledge that you can use in all facets of your life. So choking is very bad. Now let's look at the signs a person is choking. Like you can see those pictures. Now, the universal sign for choking is hands clutched to the chest. Yes, that's the universal sign of choking, because automatically when a person chokes, you'll be like trying to, oh, that thing that is on my neck, oh, you hold on to your neck to see if it will help alleviate, help reduce the pressure and the pains or whatever situation that is on ground. So that is the sign, clutching it. And if the person doesn't give the signal, look for certain indications. Sometimes some people don't actually give the signals. So you as the first aider, you that is has the key knowledge and the right knowledge, then you have to try to decipher, because it's not in all situations that someone will get to tell you, oh, I'm choking. Can you even talk when you are choking? Or you see the signs. It's not, or the person telling you. So you have to try to read the signs. Sometimes you can see inability to talk. A person that was just talking, yes, saliva chokes. So if you have the saliva actually choking in such a situation, you see the person will not be able to talk again. So inability to talk, immediately as a first aider, as a healthcare practitioner, you need to read the signs. Very important. Now, difficulty breathing or noisy breathing. Sometimes it could be, that's noisy breathing. Sometimes. Yeah, you can see that. Or difficulty breathing. The person is not squeaky sounds when trying to breathe, cough, which may be either weak or forceful. You see, sometimes when people choke, the first thing they do is to try to cough, and whether that thing can now unblock their airways for them to be free. Skin, lips, and nails can turn blue or dusky depending on the severity of the choking that the person is actually experiencing. And if left to continue to progress, it can result in loss of consciousness. The person can just fall down and then lose consciousness. So these are some of the signs that most likely we can see while choking. Now, first aid for choking. If a person is unable to cough forcefully, if the person, I beg your pardon, sorry, if the person is able to cough forcefully, because the first thing will be like, okay, cough, so that you see. So if the person is able to cough forcefully, the person should should keep coughing. Coughing is a good thing. So that's cough. Try to see if you can bring it out. And if the person is choking and can't talk, can't cry, or can't laugh, because you can't do anything that will exactly laugh or cough or do anything, a 5 and 5 approach to delivering a first aid is very important. Why we call it 5 and 5 is that you do 5 things. 5 alternatively. You do this alternating. When you finish this 5, you do the next 5. That is why it's called 5 and 5 approach to delivering first aid for choking. Now, what do? You give the person 5 back slaps, blows or slaps we used to call. Give 5 back blows. Stand to the side and behind a choking adult. Now we are going to watch this video by the side, which is very, very short. It's very short. So you just get to see what to do in a nutshell when there is choking. So stand to the side and just behind. Deliver the 5 separate back blows between the person's shoulder blades with the heel of your hand. The heel of your hand. That's down of your hand. You see it there. We are going to see the video. And then tomorrow is also the practicals. I like to make sure that so that you don't learn through the practicals, the video can help you, or the talking can equally help you. So believe me when I said that you don't have to be a medical practitioner to actually meander through this training. Like I try to tell people, that is something that if you just follow up gradually, because I try to bring it to the barest, to the simplest way possible for anybody, regardless of your educational affiliations, you will be able to understand. So now, we also talked about delivering the back blows, shoulder blades with the heel of your hand, abdominal thrusts. You would also see it is something you will see here, and we'll also do it tomorrow, God willing. Then perform 5 abdominal thrusts, also known as the Heimlich maneuver. That's what it is called, the Heimlich maneuver. Most times it comes out. They can ask you the act of actually giving the 5 abdominal thrusts, and the 5 and 5 approach is what you have to answer. They'll give you A, CPR, B, Paul, C, Peter, and then maybe D, Heimlich maneuver, and then you have to pick the right one. So you see, it's actually not as we will not have to break a bone for it for the exams, really. It's something you just get through. So alternate between 5 blows and 5 thrusts until the blockage is dislodged. So once again, let's quickly, because time has to favor us. Let's just take a look at this.
In this video, you'll learn to administer first aid to a person over the age of 1 who is choking.
Okay. Please, is it loud? Is it clear?
Yes, it is.
Yes, ma.
Okay.
Yes, it is.
Okay, so let's, why did it jump to, okay, so let's go.
In this video, you'll learn to administer first aid to a person over the age of 1 who is choking. There are 3 possible scenarios. Scenario 1. The casualty is breathing, but with difficulty. Encourage the person to cough and don't do anything else. Coughing is the most effective way of dislodging an object. Doing anything else could worsen the situation. Scenario 2. The casualty is not breathing, but is still conscious. Support their upper body with one hand and lean them forward. Give them up to 5 sharp back blows between their shoulder blades with the heel of your hand. If the back blows don't work, alternate with a series of 5 abdominal thrusts. Place your hand clenched in a fist in the middle of the abdomen, just below the sternum, in the hollow of their stomach. Place your other hand over it. Bend the casualty forward. Pull sharply inwards and upwards. Alternate 5 back blows with 5 abdominal thrusts until the casualty is breathing normally. Scenario 3. None of these procedures has worked and the casualty loses consciousness. Call or get someone to call the emergency services and start cardiopulmonary resuscitation. Alternating 30 chest compressions with 2 rescue breaths. If you don't know how to give mouth-to-mouth breathing, do chest compressions only, at a rate of 2 per second. Continue CPR until medical help arrives or the casualty starts breathing normally.
Okay, so that is a very short video, like I said, and that has practically shown us what to do. Sometimes you just have the minor choking where someone eats and then the person is choking, and then you just advise them cough, 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 and the person coughs, and then whatever blocked the airways comes out and the person is free. You may have the second scenario where you will have to carry out the Heimlich maneuver, where you will have to give the abdominal 5 thrusts, and then you give the back slaps first. And then if the back slaps doesn't work, you fold your hand, you clench it into a fist, and then you put it just below the belly, the hollow of the belly, below the sternum. And then you give the 5 abdominal thrust. So it's important that we learn this technique. And then so that in case of choking, in the environment, our neighbors, our children, and our families, you know, there are things we should be known for, little things like first aid, these things that are related to us, that are relevant to us, should learn how to do them. So practically, that is what to do when there is. Then if all effort proves abortive, if all efforts does not work out, then you know the next thing to do. Like you can see, that's the third aspect. Maybe you've done the abdominal thrust, you've done everything. Of course, I told you that the person would likely go unconscious, will lose consciousness, maybe to the ground. So you try to ensure that you carry out the CPR. So you see that CPR is very important. Be it choking, most of the situations, we actually carry out a CPR. And maybe in the course of you carrying out the CPR, the person actually gets better. You then put the person in a recovery position. Tomorrow, we are going to learn that how to place a casualty or a patient in recovery position. That's the position you place the casualty after the person is revived. Maybe the person is breathing now, is getting better. So you put the person in a recovery position, which we are going to see, because recovery position is very, very important, especially when it comes to the exams. So that is the Heimlich maneuver that we just talked about, first aid for choking. Now, there's another situation that I would want us to look at. Please, are we together? Did we learn one or two things from the video?
Yes, ma'am.
Yes, ma'am.
Yes,
Okay,
ma'am.
all right, so let's look at heart attack. This one is very, very rampant, very common. Hence, we decided to put it. It's very, very, very common. People get to all this, someone slumped, someone had a heart attack, someone had a cardiac arrest, someone did this and someone did that. It's the in thing. So it gives us cause for concern. So a heart attack actually happens when the supply of blood to the heart is suddenly blocked. Like you see that the heart, we talked about anatomy and physiology the other time, and we said that different organs work together to maintain your homeostasis, the level with which all these organs have to be functioning at the same, that's functioning in their proper manner in order for you to remain healthy. So if it does not, the brain is a very, very important organ, and then your heart controls everything. In fact, your heart controls life. So when the blood, there is maybe a blockage in the blood due to anything. It could be due to maybe you having a high cholesterol level. It could be as a result of so many things can cause blockages in the heart. So when there is a blockage in your heart, maybe your blood clots, that's your blood thickens, that's the meaning of clot. It hardens and it clots. It doesn't flow freely like the watery one. It clots, it blocks. It's just like a pipe that water runs out freely. When there are dirts or when there are things that will block it, maybe solid thing blocking it, you find out that it won't be easy for that blood to just move out. So that's the situation that I'm trying to relate here now. Lots of people make a full recovery from a heart attack, but there's a serious risk that the heart might stop beating. And when the heart attack is like the first stage. When the heart eventually stops beating after a heart attack, it becomes a cardiac arrest. It becomes a cardiac arrest. That is, there is a total malfunction of the heart, a total malfunction rather of the heart. That is the cardiac arrest. So it is important that when someone has a heart attack, that person something is done immediately. It's vital that you treat someone having a heart attack straight away so that it does not degenerate to become a cardiac arrest, because a cardiac arrest is the senior, let me use that word, is the senior brother to a heart attack. A heart attack is, well, with one or two CPR and some things done, you can still manage, but a cardiac arrest kills faster within seconds if nothing is done. If someone just has a cardiac arrest now and they don't carry out CPR, people don't know what to do. People are there, video like Mildred said, people are there having a nice time. Before you say Jack and you say Robinson, the person is gone. So it is important that we at least know what to do. That's why CPR is very important. Now, there are people that have excuse me. There are people that have angina, I know that some of these medical terminologies are a bit I don't know, for people that are not into the medical field, but some people have angina. What is this angina or angina, depending on whether it's a British pronunciation or it's the American? Now, Angina is a type of chest pain or discomfort that occurs when the heart muscles does not get enough oxygen in the blood. Please, let's mute. Let's mute, please, so that we finish before 8. Now, sometimes people have, people have illnesses, really. Some illnesses are such that they are such that we cannot even explain. We just get to see now. Before you know, those in the medical field will give you big terminologies. Sometimes you get to hear some names that you will be wondering whether this kind of name is even existing in the planet, because there are illnesses that we cannot really there are so many illnesses, let me just say so. So when someone has angina, like people who have angina was trying to say, is a type of chest pain or discomfort that occurs when your heart muscles, there are muscles in the heart. There are muscles that make up the heart, like you can see that picture. So when your heart muscles doesn't get enough oxygen-rich blood, because the heart needs that blood, red, rich oxygenated blood, to enable your heart to function, to enable the electrical functions of your heart to continue operating, because our heart is just like the sockets you have. It's just like an electrical gadget. Let me say so. I don't want to say gadget because God created the heart. Man creates gadgets, but just let's look at it like that. Electrically, if there is a malfunction, the sockets will not work. You want to plug, maybe I want to plug this laptop, giving you this training now, and there's a problem with my power source, my power supply. It automatically makes the laptop not to power on. So that is how it is. So people that have angina have issues with the oxygenated blood. It's not rich enough and does not flow enough within the heart muscles. That's where angina comes. So it's often a symptom of an underlying heart condition. Maybe some people that have coronary artery disease, CAD, or they have one thing or the other that affects or distorts their hearts. So that is very, very important. Someone is sending a message. Just bear with me. Let's see what is. Network has locked me out. Oh, Helen, so sorry about that. So sorry that network has locked you out. Okay, so as I was saying, that is angina. So people that have that medical condition are prone to, having all those challenges that we have talked about. So they are prone to having cardiac arrest. They are prone to having heart failure, coronary heart diseases, and so on. And this angina, they are of types. So we have the stable angina, the one that maybe occurs during physical activity or stress. Maybe you are really stressed, and it usually goes away with rest or medication. It just affects your heart. The muscles are troubleshooting because all you just need is to rest. So that one is like the stable angina. We have the unstable one that occurs unexpectedly. It can happen at rest, and it's more intense, more severe when it happens. It most times results into you having a cardiac arrest. So needless to go too deeply into those medical whatever, but angina happens when the arteries to the heart becomes narrow and the heart muscle cannot get enough rich blood. This can happen when someone doing a physical activity. It can happen when you are doing a physical activity and the muscles of your heart is actually having issues. So angina comes. So angina pain is usually a tight chest pain, very tight, that may ease if you rest straight away or you take the medications if you've already been diagnosed of having it. And the pain lasts longer. Presume it's a heart attack. So these are some of the things that we need to actually know. Signs and symptoms of heart attack.
You are defining sorry for me using tree. Why did you put the tree there?
We are still having challenge of echoing into what we are doing. I don't know how I would want to overemphasize the need for us to mute our mics, please, so that we can finish. Because when people are listening and then someone just interrupts with a noise, it does not help us. Please, let's do what we need to do.
Let's check Julia, check her mic.
Okay, I think she has done the needful. Thank you. I wasn't really looking at the name. Thank you, Madam Ugweze, and I'm happy you are better, much better from your voice. So, signs and symptoms of heart attack. We have the warning signs that come. I tell people that if you listen, it still boils down to mental health we talked about. If you listen to yourself, there's nothing as important as listening to yourself. This time yourself, because you can't listen to another person. It's the person that will tell you and you check to know. But yourself, you can listen to yourself. So if you can listen to yourself, now let's look at ourselves. There are warning signs. Symptoms can start suddenly, or it can develop over time that you have loose guarded. That's you have loosened your guard. You are not conscious of what is actually happening. Maybe you just feel those signs. You feel maybe the chest pain occasionally, and this you just say, oh, it's stress, or it's just this, or it's just that, you wave it away. No, we should develop a habit of actually checking ourselves, checking our heart condition. Very important. Checking a whole lot of things, doing exercises, checking your cholesterol level, because cholesterol is something that when you have it in excess, that's story for another day. Let me not delve into that. So practically, this chest pain can start suddenly or slowly over minutes. Tightness of the chest, maybe heaviness, fullness, or squeezing. It can be severe, it can be moderate, it can be mild, whatever sign. The chest, the heart is a delicate organ. So when you hear anything, do not hesitate to get yourself checked. Do not say, because I am working, because I want to put food on the table. Oh, because I need to go to work today, I cannot afford to. No. I have learned one thing over time. Now I'm talking to you as, like, let's remove ourselves a little from the patient's healthcare scenario. Let's look at ourselves as individuals now. When I was working, I used to have that challenge because I'm a person that I like to work a lot. That's the truth, especially if I'm doing what I delight in doing. I find it's easy to do. If not that, Zoom regulators, and then professionally you have to keep to timing. If I'm left with the fact that, okay, Dr. Mrs. Dorothy, just keep talking, keep teaching this thing in-depthly into what you know, touch all the pros and cons. I tell you, all of you will sit down here, 9 p.m., you will all stand up and leave me. I am still here on this stage. You understand? That is the kind of, I mean it, I'm very frank. So, but I check some things. I give myself checks and balances when I do this training. So over the years, I try to really stabilize, because I have taught for years, and teaching is just a part of me. I don't even train when I train. My own trainings are not stereotyped towards the normal trainings, if you look at it, because I do more of teaching. I like to teach more than train, but I guess that's just fine. That's why I have built my name over time. So what am I trying to say? Let's not say that because I want to work, like I know, like Madam Ugeze loves to work a whole lot, and a couple of us. So let's not say, I have to work. When I was working, like I said, I will go to school. I remember vividly that I will go to work. I will not be feeling fine, but I will go. My mother, then I wasn't married. Like I started working quite early in my life. So I have put in a lot of years into my work life, and I'm still counting. I don't even know when I am going to stop. So my parents would tell me, don't you think that you should not go to work today? You need to rest. I say, no, I have to go to work. Those children, they are really going to miss me. I have to be there. I wouldn't want another teacher. Perhaps I'm thinking of the story I want to tell them. Perhaps I'm thinking of the unfinished notes I did not mark, and a whole lot of things. Seriously, candidly, that was the bad aspect of me as at that time. I was not even checkmating myself. I just wanted to do because I wanted to stand out. Anything I do, I like to stand out. That's one thing I just like to stand out. If I don't stand out, then I've not done that thing. So I did not understand that time. I didn't know mental health. I must tell you the truth. That time I wasn't into mental health things. So I did not even know all those ones. I would just think that mental health is just about a mad person and all that. So I kept going to work and working, but until I met one person, one of my colleagues that's just like me, that I know very well. She's late now, of blessed memory. She works just the way I do. And she kept going. She was passing through, I think she had, I don't know if it's, they say whether diabetes or so, I don't know. Yeah, and she wasn't telling anybody. She was just there. So when you ask her, she would not just be telling you anything. Well, we just left her, in a workplace, you stay within your limits. That type of thing. She will call you in school, stay at, the day I stayed away from work, I had nearly all the whole school coming to visit me. Because my head teacher at school's administrators at that time said, no, Mrs. Dorothy. No, I wasn't married then. So, Dorothy, For you to stay away from work, we all had to come because we know that it's serious. And that was the truth. It was very serious. Like, I couldn't help myself to go to work that day. So what am I trying to say? That particular colleague of mine of blessed memory, I'm telling you the truth, she will go with diabetes, she will go with what do they call this thing? Cannula in her hand. She will even take it to school just because she didn't want the children to miss her. At the end of the day, she died. It's a sad story, but at the end of the day, she died. As I speak to you, she's gone of blessed memory. And you know what happened? She died on Monday. By Wednesday, she was replaced. Another teacher was in that class with those very children that she could not stay away one day from seeing. That's what I am trying to make people understand. So even as you work, check your health. As you check the health of others, your health is more important because you have to be able to check your health, to be in good health, to check another person's health. So this issue of a heart attack and cardiac arrest has killed so many people than we can even imagine. So it's important you keep checking your cholesterol level. You keep checking yourself to ensure that you are in good you are in good state. Chest pains, do not disregard anything. Listen to the signs. When you don't feel too good to go to work, stay at home. Forget about it because you want to put food on the table for your husband. You want to put food on the table for your children. The truth of the matter is that if anything happens to your children, nothing will happen to them. They move on. That's just the truth. Your husband will move on or your wife will move on, vice versa in any other way. So it is important that we check our health. Discomfort in the neck or a choking or burning feeling in the throat, pain, discomfort, ache, tightness, you just listen to the signs, listen to yourself. And if you feel anything out of the ordinary, don't hesitate. Don't say, I will go tomorrow. Don't say it is well. Let it be well. Yes, like we Christians say it is well, but let it be well in the hospital after you have done your checks so that you are sure that you add the spiritual aspect to the medical aspect and you merge it together to come out well-rounded. That is what I tell people. So, however, not all patients actually feel this chest discomfort. Not. Some don't even get to really have the signs, just as we are different. People are different. If we talk about maybe menstrual cramps and menstrual pains for women can relate to that, you find out that people are different. There are some that throughout those days, they will not be themselves. They will cry, they will shout, their leg will be up on the ceiling. I had a friend like that, and I always wonder, what kind of thing is this? Whenever it was those few days, she'll be in pains. She'll lift her leg up, she'll dance, she'll do this, and you pity for her. But here you are, you don't even know what is even happening because you feel little or no pain. You are your normal self and life goes on. So you see, people are different. So it is in health, in all illnesses. The way someone feels concerning a particular thing may have the signs, but there are others that may not have the signs. That's just our body, the way our body is structured differently. So not everybody feels the sign. More than 40% of women do not even experience chest pain. There are some that experience the pains, especially that experience the pains. Shortness of breath, dizziness, cold sweats, any of those signs. Just get to know if you are, maybe you are up to 50, like I hear people really used to say, if you're up to 50 or thereabout, depending on the age, there are some of the signs of menopause that can be mistaken for this thing that I'm saying. So it's important that overall you check yourself and know if you are in good health or not, like you can see there. You see cough, shortness of breath, like you can see from the chest tightness, pale skin. Oh, there's another sickness they call arrhythmias. It's an illness. I don't want to bore people with all those terminologies. Vomiting and anything. In fact, the A to Z is any warning sign, anything you see as a sign, do something about it. Now, what is the first aid for heart attack? To training. First aid, come back for immediate emergency for help. So as you are doing that, trying to see how to help the person hold on to the thread of life, paramedics are coming, or the person is being conveyed to where the person will have the normal treatment. That is what a first aider really, really does. That is the objective of you being a first aid, rather. Then help move them into the most comfortable position. In this case, heart attack, not a limb issue or sprain or strain or all those things. So move the person to a comfortable position, like you're comfortable and shoulders supported. This should ease the pressure on the heart. When you do that, it's easing the pressure on the heart and stop them if they collapse. That's another advantage. So be aware that they may develop shock. Shock, like we said, does not mean maybe the shock of something, emotional shock. This happened or that happened. No, it's a life-threatening condition which can be brought on a heart attack. Someone has a heart attack, it can result in shock. Keep checking their breathing, their pulse, if person still remains or the person becomes unresponsive. So this is practically, do not worry. Maybe it may be as if I'm talking too fast, I'm moving the slides. Like I said, I needed us to have this with us so that it can give us like a follow-up, everything you need to know. Trust me, you would get it. BCC UK and the Smart Solutions, we are poised to ensure that anybody that does any training with us, you are well grounded. Anyhow, anywhere you become all weather, like people will say, any weather that you meet, you'll be able to withstand the weather. Hence, we ensure that the curriculum is rich enough. So having said that, let's see how to walk to the next one. I think this should be the last one, if I'm not mistaken. A stroke. Now, another thing, a stroke, it occurs when the blood supply to the part of your brain, now this time the brain and not the heart, the part of your brain is interrupted or reduced. People keep having stroke, elderly people with age, maybe with their lifestyle, you know, it comes to us. Like I tell people, anything you do much younger, when you age, it gets to you. Anybody that passes, that clocks from 40, you start moving down, with age comes certain things. So you have to make good choices while you still can, so that it doesn't affect you. So it's a brain attack, like we said. It happens when the blood supply to your brain is interrupted or reduced, maybe due to one reason or the other. The blood does not move. Like you can see that picture. You can see that it's pale. You can see that the blood is not actually circulating effectively, you know, or is depriving the brain tissue of oxygen and nutrients that should get to the brain. Within minutes, brain cells begin to die. You can see this is another serious challenge. It doesn't take long. That's why it's when someone has a stroke, if you don't sense it, if you don't act fast, it goes to full-blown stroke. The person, before you know, one part of the body, and that is what happens because everything is coordinated from the brain. You want to ease yourself, it's your brain. You want to talk to someone, it's your brain. I'm teaching you, I had to make use of my. So everything around us starts and works with the brain. So if there is any maybe oxygen being deprived from getting to the brain, or there's an interruption of blood supply to the brain, automatically the cells in the brain die. They just begin to die. So a stroke is a medical emergency and prompt treatment is crucial. Early action can minimize brain damage and potential complications. Hence, we have seen it there. Now, pay attention to when the signs and symptoms begin, because the length of time can affect your treatment. That we cannot talk about it too much. Cardiac arrest, heart attack, all those very, very serious issues or challenges that people have or people have had, sicknesses. It's important that you act fast, because the faster you act, the higher the chances of that person pulling through or surviving that particular incident. So like now we have trouble. Look at some of the things. Most of the signs, you see someone having trouble with speaking and understanding, paralysis or numbness of the face, maybe the mouth goes to one corner, you know, and you begin to see some things. Troubling with seeing in one or both eyes, headache, trouble with walking. Some of these are symptoms. Like, you know, in the health, those of us that are in the health field, you will understand that some of the symptoms of certain illnesses are intertwined. You can have headache now. You have malaria, of course, automatically it comes with headache. You understand? You have a stroke, it comes with headache. You have maybe some other illnesses comes with headache. So that is why it's very important that a diagnosis is you need to actually know what is wrong before you treat yourself, because many symptoms can be intertwined. It can look like it looks like it is this, but it is not this. That's why you actually need a medical practitioner at the end day. Very, very important. So I hope I'm not talking too much. Are we together? Can everybody hear me?
Yes.
Yes, ma'am.
Yes, ma'am, we can hear you.
Don't worry, we'll soon be done. So we have now stroke. We have what we call there's treatment if you act fast. Now, stroke, people that have had a stroke, if they act fast, or people that are having stroke, having signs, if you act fast, it will not be that serious. Now, why we say fast, this fast is also an acronym for you identifying stroke and knowing what to do. Now, F here is for face. You see, like that picture, the face looks uneven. One side of the face is tilted towards one direction. Ask the person to smile. Does one side of the face drop? So if a person is trying to have stroke or is exhibiting those symptoms, look at the face. Is the face one part dropping or is it aligning? Very important. Now, one arm hanging down. People that have stroke, most times, one arm, you even see the way they carry their arm, you know that something is wrong because they will not have that stability that ordinarily a person would have if you are intact. Now, how is the arm? Does one side drift downwards? Slurred speech. This is a very, very important one. S is for speech. Slurred speech. When they talk, ask the person to repeat a simple phrase. You can tell the person, are you hungry? Please, can you repeat? Or any phrase at all, something simple. Just, it doesn't have to be long. And let the person talk. You see the person is having slurred speech. The person is not able to form words, or the person is talking in a very strange way that you don't know of that person talking like that. So these are some of the symptoms. And then T, call emergency assistance immediately. That is the FAST. So FAST acronym is one that every healthcare person should know, because it should be in your brain. You just remember, you know what it means. Face, arm, speech time. That's how it's to do. Face, arm, speech time. So when you look at those, you know exactly what to do. The face is the face. You carry out the test. The arm, do like this. You ask to respond. The person cannot respond immediately without wasting time. Call for help. Now, stroke first aid. Support the head or shoulders on pillows. Remember, this is what you do after calling for help. Loosen tight clothing. If it's a tie or something that is tight, loosen a little for fresh air. Wipe away secretions from the mouth. Of course, with stroke comes secretions. Maybe saliva will be coming out, or whatever fluid. Wipe away the secretions from the mouth. Maintain the body temperature. Ensure the airway is clear and open. Airway, very important. Like in recovery position, when you see it tomorrow, you see how to clear the airways. I know we've seen it, but you see it firsthand how you can clear airways, because it's important. Most of these illnesses and diseases has got to do with clearing of airways. So it's important. That's a skill that you must learn. Then unconscious casualty, place them in the recovery position, still recovery position. So everything is intertwined. Tomorrow you see how to place a person, a casualty, a patient in a recovery position. That's the position that after you've done that and you have seen signs of the person beginning to regain consciousness or beginning to breathe, or the pulse beginning to come back faintly and coming back, you put the person in a recovery position where you can tilt the airways and ensure that the airways is clear and open. You see anything that comes out and nothing obstructs the airways. We'll see that practically how it's done tomorrow, recovery position, by God's grace. So you can see what to do with a conscious casualty. You can see there. Then unconscious casualty, place the person in a recovery position while you await paramedics while they come. So this is important for us to note. Now, let's see. Okay. Then we have, let's see, what is the time we have? Okay, we still have time. So burns, the skin is sensitive to heat. We have different levels of burns. Very important. We have different causes of burns. It could be as a result of heat. It could be as a result of electricity, or it could be as a result of chemicals, depending on where we work. So we could have chemical burns. We could have electric burns. We could have heat burns as well. So this is very important. And also, we need to learn the degree of burns, because the first aid that we give for a particular situation is not the same that we give for the treatment. First aid treatment for first degree burns is not the same as second, is not the same as third. In terms of depth or area of involvement, we need to know so that we know the first aid we can render if we are faced with such a situation or a challenge as a caregiver. Now, these are the degree of burns. We have 3 degrees of burns. I don't even know where to keep this thing anymore. Oh. Okay, so we have 3 degrees of burns. We have the epidermis. Skin. Sorry, I beg your pardon. Skin. We have levels of the skin. Our skin, we have the uppermost level, the toppermost level. That's the epidermis. That's just the surface. And we have the dermis, which is the second level, and then we have the hypodermis, which is the third level. The right inside layer of the skin is the hypodermis. So the first degree of burns is just on the surface, is the burns that actually maybe affects the epidermis. That's the toppermost layer. You can see there with the picture that is there, you've seen the first degree of the burns just on the surface. Maybe it could be heat-borne, it could be something very mild that has burned you, like you can see that red spot there. So that's the first degree of burns. Is only on the top layer of the skin. That's only the top layer is damaged of the skin. And the skin color is pink to red. It's not very much reddish. It's just pinkish to reddish to show you that it's not very severe. And you could have the slight swelling. The skin is dry. The burn can be anywhere from tender to severely painful. It could move like that. And it's only on the top layer of the skin that is damaged. That I must emphasize. That is only affecting the epidermis, which is the uppermost layer of the skin. And then we have the second degree burns. The second degree burns, like you can see there under the, you can see right there. You can see the second degree burns where you have the first and the second layer. Both layers of the skin are damaged. That is the top, the second, and the third. You see the first diagram there had only the first. Now the second degree burns affect first tier, which is the epidermis, affects the second tier, which is the dermis. That's the second degree burn. And then the third degree burns, you can see it there clearly. So from the wound, even the man with the open palm, there you can see how severe and serious it is. So third degree burns are the most serious of them all. Second degree burns is serious too, but not as severe and serious as the third degree burns. And then the first is the less serious of the 3. So these are ways that you can handle them. These are signs that you can know that, oh, this particular thing, it's a first degree burn. The person is suffering from this or is suffering from that. So I took time to ensure that, Dami Lola, please help us mute your mic, I think. Okay. So based on that, easily based on this table that you take time to study, first degree, second degree, third degree, you would see the differences between the 3, how you can spot a first degree burn, how you can spot a second degree burn, and how you can do the same to a third degree burn. And their ways of being treated or their ways of being handled are totally different depending on the level and the degree of burns that those patients or casualties actually sustain. Okay. Very easy burn apply. You cover with non-stick sterile dressing. You remove the clothing and jewelry from the burnt area, maybe with wristwatches or whatever that is there. You remove it, and then do not break the blisters. I tell people that, you know, children like to do that, especially if maybe they have blisters as a result of burns. They want to pierce it. They want the blisters to, you know, they want to break the blisters. It's not good. It's not good to do that. Then third degree burns, cover with sterile clothes. Watch out for difficult move, chat, clothing. Maybe somebody third degree burn, the person is burnt up to the extent of the cloth. Maybe there's a fire outbreak somewhere and then the cloth is burnt and it aligns with the person's skin. Do not want to remove it as a first aid, and your jurisdiction does not cover that. So you don't remove the charred clothing, which has been glued or gummed to the burnt area. We shouldn't remove those things. So another one is spraying. Now, spraying. What to do when you have spraying. These are the steps. practical steps. It's usually when you have maybe a sprain is an injury to the ligaments. To the ligaments, we have ligaments in our systems, we have bones, we have this. So you can, your leg can shift. Let me use the layman's language. Sometimes your leg can shift and you can have a form of, you can have a sprain on your ankle or on your wrist or on your thumb, and so on and so forth. So, and it can affect your ligaments. It can tear. We have the tibia, we have the fibula. So the tibia and the fibula are parts of our legs that are in bones in our body. We are going to see tomorrow that sprain. You can easily sprain your ankle and it causes pain. I don't wish my worst enemy, because I had experienced that sprain one time. I don't wish my worst enemy. It is painful. It is very painful. Now, it happens when the tissues are stretched, maybe twisted or turned by violent movement or sudden movement. For instance, you want to, someone changes direction suddenly or lands awkwardly. Instead of you to maintain your balance when you land, you can just shift. Your leg will just move a bit, you shift, and you are displaced in your landing. Your leg can just, you can just have a sprain, which affects the ligaments, affects the bones around the ankle, like you can see from that illustration and that picture that is there. So what do you do? Rest. This is the first aid for sprains. RISE, that's how it is called. We have several acronyms. RISE, rest, ice, compress, and elevate. Those are the 4 things you need to do. If you have a person that sprains the ankle, assist the patient into a position that the patient can actually sit down, support the patient, or lying down, either sitting down or lying down, being supported. Rest for up to 24 hours is helpful. You need to rest. You don't have to stress that leg, that particular place you have the sprain. Good. So that it can see whether it can heal, whether you can begin to feel better. That is right. So RISE, R in RISE is rest. You need to rest. Then we have the ice. An ice pack will help to reduce pain. It's always in a first aid box. We should have it. Ice pack can help. Wrap it around the towel to protect the skin. Don't apply it directly, so that ice pack can help to make the person, relieve the person of the pain. Always wrap your ice pack in a cloth, in a damp cloth, before applying it. Don't just, I've seen people use ice packs, they just place it like that directly. No. Then compress. Use a roller bandage on an injured limb. Very important. Use a roller bandage. If the bandage increases the pain, do not persist with it, because sometimes you can use the bandage trying to see how to bandage the area, but it's increasing the pain for the person. That means something is wrong. It could either be maybe the bone is affected or something. So you need to be careful while doing it. Now, elevate. Good. So the E is for elevation. Keep the injured area elevated and at rest, and arrange for medical advice, like you can see there. Use simple pain relief for the person, but I don't advise first aiders to give medication. I don't. Rather, a medical practitioner should give the medication if the need arises. But for you, maybe for your family, you can take responsibility of it. You can just give maybe a paracetamol to cool the pain. But for a caregiver outside, it's always advised that a medical practitioner does that. Now, and patients who have significant loss of function or severe pain should be seen by a doctor or a physiotherapist. Very, very important. Okay, so the last but not the least is just 2 slides to go. Talks about your professional development. This one doesn't have too long. As a CACA, you need to ensure that you keep upgrading yourselves professionally, keep developing yourself, because things keeps moving in the health sector. We keep having things, we keep having upgrades. We keep having upgrades. We keep having people learning different trends, telepathy, technology in health, and a whole lot of things. So you need to keep enhancing your skills. Continuous learning improves your skills. You keep moving, advance. You can decide to major in a particular field, because the specialized ones actually earn more. Specialized ones actually earn more when it comes to this. So you can be a CHCA that has a special, an area of specialty, maybe geriatrics, maybe pediatrics, you know, a particular field where you have to deal with these people. You earn more than just being a general practitioner, being a CHCA. Today you are in the labor ward, tomorrow you are in this side, next tomorrow you are there. No, if you are a specialist, you are kept within the area of your specialization and you earn more. So increase confidence. 2, gaining knowledge boosts your self-esteem and your confidence. Hence, you have to continue developing yourselves professionally. Very important that we take note of that. There are different ways that we can improve. Okay, thank God we've come. There are different ways that we can improve ourselves. Formal education, workshops, seminars, certification courses, e-line courses, and so on and so forth. Networking opportunities. We have Association of Healthcare Assistants, professional organizations. Don't just stay alone. Just say, oh, I had the training in BCC, UK, and it's Smart Solutions. Oh, that's all. You just rest. No, you keep learning. You keep taking more courses. You keep taking courses that will give you specialty, that will give you more money, that you earn more, that you develop. You can take on the job trainings, because most of these facilities, when you actually get jobs, they give you on the job training. You learn on the job. They give you in-house trainings to make up, like to cap it on top of what you already learned. Very important for us to take note of that. And then, very importantly, I think that's the last, improve. These are the reasons: foster a work environment, enhance clinical skills, learn a new language, advocate for patients' rights, and quality care. So summarily, before I wrap it up, I draw the curtain. Oh, 8:01. So before I draw the curtain, I want to crave your indulgence. I want to still sound it. I want to still advise because you're now officially welcome into Andy Smart Solutions, MJB Management, and BCC UK alumni. Is very, very important. And as God would have it, sometime soon, would have to have them come over to meet us here. God willing, I don't know. So it is important that we get ourselves well equipped, very, very well equipped. So I had to talk to a couple of us, and I was glad to hear we already have BLS, basic life support certifications. And of course, some of them I saw, some are from legit places that will actually make them have that edge that we are looking for. Because one thing is to have a certificate, and another is to have a certificate that is globally recognized, that you can take it anywhere and it can still stand the test of time. Not harboring a whole lot of certificates that you cannot actually use when the need arises, and you flog yourself for wasting all those money. So it is important. If you don't have a basic life support certification, you don't have a first aid or CPR certification, thank God we all on this platform have the mental health awareness certification. So that's a plus for you already. You will not have to go and pay over 40,000, I guess, just to get the certification of one day's training, because it's important. So it's very good. It goes a long way in giving you that edge. So try. We are talking about professional development here. So if you don't have, please do the needful. If you have any issues, reach out to me at any time and then ask. I can help you, put you through as to what, especially if you want to become a professional in this field, like you want to attain those heights that I know we may wish to attain. So that having said, I don't know if we have any question or any contribution. If there is none, then we have come to the end of today's training, and I want to know if we are together, because I want to know the number of people that have stayed with me till the end.
Yes,
Well,
ma'am,
I
we
have
are.
a question.
Okay.
Yes,
Okay.
ma'am, we will
All
see.
right. Thank you.
I'm
You
here,
for staying.
yeah. I'm here.
Okay. Gift to Sareme. You're welcome. I can see you now. I didn't see you that time when we started. So I want to say a big thank you to you. I want to believe we learned one or two things. So before I leave, I just want to be happy so I can go and sleep, and sleep very fine. So I would just want to hear just a single person, just one person, to tell me just one thing that you have taken home today before I wrap it up. Who is going to build the cast? We don't have time. So someone should just volunteer to tell us one thing that you have learned today. Just one thing in a sentence is all I need. Anyone?
Okay.
Hello?
Can I talk?
Okay,
Hello,
please do.
Mildred.
Go ahead. Go ahead, Mildred.
Okay. The most interesting for me here is the stroke and the symptoms of stroke,
Yeah,
because
okay.
it's very, very common now. It's not
That's
even
right.
for just people above 40. I've
Mm.
seen 18 years old had stroke. I've seen 23
Wow.
had stroke. Yes.
Mm. Yeah, it
Yeah,
happens. I was
because
only saying when you are up to 40, that you should be more careful with your health. That's right. Go ahead, Jay.
even somebody 10 years old died of it, even when he was taken to the US, but he didn't survive it.
Oh,
He
so sad.
back into years. He was 10 years.
Mm-mm.
So at least I'm taking home but the stroke and the symptoms, and at least prevention, because
Okay.
yeah when you know the
Nice.
symptoms, that is the blood
Of
not flowing
course.
properly.
Of course.
So
Yes, yes.
fine. At least one can be able to control, know what to do, not to have it. Then also, my mom died of a heart attack, and
Oh,
I have
sorry.
learned a
So
lot
sad to
too. Yeah,
hear. Yeah.
2022 she died of heart attack. So
Mm-mm.
if we had known on how to take care of it
Handle.
when it started,
Yeah, yeah.
at that early stage,
It would
it
have
went
been.
too bad. So that was why she didn't survive it. So if I've known all this, none of us in my family is into health sector,
Healthy.
in none.
Yeah, yeah.
So I've learned a lot actually. Then
Thank
somebody
you.
asked a question behind the camera.
Okay.
She said, "Is there no admission letter?" Oh, somebody
Yeah, in the
asked me that
camera.
question. I said,
Okay.
why didn't you ask Madam Dorothy? I'm not.
Jesus. Okay. Thank you, Mildred. I think Mildred is the spokesperson. So thank you, Mildred, for coming out, for coming from behind the camera. Thank you. Okay, it's good you ask. Me, I like Dr. Mrs. Dorothy is a very amiable person. So even if you don't ask on the platform, you call me. Even in the midnights, I see any call from anybody in the race, I will definitely pick. So the fact is this, what we normally do, what BCC does is they wait until all enrollment is done because they send the admission, how do I put it? They put together all the admission letters at once. That's just as the certificate comes. That's why if someone does not pay for the certificate before it is shipped to us, maybe you don't complete the payment, subsequently, it takes time to be able to start going, moving with yours alone. So like I had said, I had requested today on the platform, thank God we all have all registrations. I had requested that those people that have not submitted their forms, because it's going to be difficult to go forward and backward. Today, 2 people submit form, you go and get, or you request for their own. Next day, 2 people, no, it doesn't. We'd like to do things collectively so that we can, because the distance is not just here. So we do a lot of partnering with them. So for those people asking of admission letters, do not worry at all. You be rest assured that you will get them. I can assure you that, just as I told you about the recorded versions, it took time, but at the end, we actually had it, and that side is sealed. So we are looking at when the forms are submitted by tomorrow. Like I said, anybody that does not submit the form, your admission letter may likely come when you are done with the training. That's the truth of the matter, because we like to do things the same time. Thank you too to those people that have submitted their forms, because I've seen a whole lot. So we have compiled the list. We've compiled everything from the forms they have received over there at BCC. They have made the letters, the admission letters available for them to be sent to us. But now the people that have not submitted their forms are actually giving us 1 or 2 bottlenecks. But be rest assured that before the end of this week, God willing, before the end of this week we should get our admission letters, at least those that have submitted their forms. So thank you so much.
Thank
Be
you so
rest
much.
assured.
Thank
And
you. God
then
bless you.
trust me, bless you too. So
Thank you, ma.
thank you very much,
Thank you, ma'am.
everybody. Then Mildred, I wanted to say something. I've had someone say something like this on the platform, but I want to tell you something. The love that you must have shown to your mother Or I think you said your mother, if I'm not mistaken. The love is what supersedes everything, because I know that even though none of you had the knowledge, like you said, about maybe health-related knowledge to help her as at that time, you all did what you could do for her. And I'm sure she took that with her, wherever she is. So on that note, thank you so much, everybody, for having
Thank
been
you.
with
God
me,
bless you.
come
Thank you.
this far. I wish you all a lovely night rest. We'll see you tomorrow. Yes, before I go, please ensure that your network is top-notch tomorrow, because as we are going to have it clear like the streets of London at night, very clear. Everything will be at technology. So please ensure that if Glow is not working, you use MTN. MTN is not working, switch to Airtel. Just come prepared for the practicals tomorrow. Do have a lovely night rest.
Why
Over to you,
why the streets of London? Why the streets of
Someone wants to
Lekki?
kill it. Okay, the streets of Lekki, but
It
really,
is
I've
well,
not
oh.
been.
We will get there.
I
We
don't
will
know
get
much about Lekki. We'll get there. Yeah, we'll certainly get there.
there.
Thank
We
you.
will get there.
So,
Nigeria will get there.
let's keep praying and do
Amen.
our own in our own little way. Somehow we'll get there by God's grace. So, thank you so very much. I appreciate all of you. You are just, in fact, this is the best set of CACA students I have had. So cooperative, so supportive. Thank you so much.
Are
God
you
bless
serious,
everyone.
ma?
You have, yes, that's CHCA. I did not say CNA. That's Certified Healthcare Assistant. This is the best batch that I've had in terms of support. You've just been, wow. Thank you so much. On that note, let's have a lovely night rest. We'll see you
Okay.
tomorrow. Bye.
Thank you so much,
Thank you,
ma.
ma.
Thank you so much,
Okay,
ma.
good night.
Thank you,
And
ma.
the smart
Good
and the
night.
smart solutions,
Good
I
night,
didn't call
ma.
on him. So let's see tomorrow. Thank you. Thank you.
So much, Doctor. Please, participants, any complaint? Do we have any complaint?
No,
Any
no. Do they have complaints?
complaint about Doctor? Any complaint about Doctor?
No, no,
Oh,
no,
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 Complain.
no
No
complaint.
complaint.
no
Very nice
complaints.
person.
Thank
Thank
you.
you so much. Thank you so much. Good night, everybody. We'll meet again tomorrow. Good night.
All
Good
right,
night.
thank you, sir.
Good
Good night, sir.
night.
Night,
Have a
everyone.
lovely night rest, sir. I'm sorry.